Senator Baldacci.
Good morning, Mr. Chairman and Chair Meyer, and everybody on the committee. I'm Joe Baldacci. I represent the city of Bangor and the town of Herman. It is Senate District 9. Thank you.
Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes Indian Township, Baileyville, Barron, Callis, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
And Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Condescate.
Representative Connor is probably an HCIFS or will be. Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
And I don't see Representative Madigan. So Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan and Hancock County as well.
Representative Javner.
Good morning. I'm Representative Kathy Javner, and I represent House District 141, which is located in Penobscot and Washington County.
Representative Meyer.
Good morning, and thank you to all who've joined us here today. I'm Representative Michelle Meyer, serving House District 2 in Southern Maine, which is all of Elliott and parts of Kittery and South Berwick.
Good morning and welcome. I'm Ned Claxton. I'm honored to represent the folks in Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. I'll make reference to the fact that we're a couple days late on Representative Meyer's birthday, but we'll sing happy birthday to her at lunch break, maybe when we're all done. So just want to acknowledge that. Happy birthday.
Thank you, sir.
All right. So that lets us get back into the work on the budget. And we have a couple of outstanding items. Some amendments that are probably not ready for consideration yet. And while I look up, Aaron was sent an email summary of what we're working on today. Do you have that email handy about what the next line item is in the green book?
Yep. Looks like I got this information from Luke, so I don't want to steal his thunder, but it's lines 347 to 349 of the green document and lines 367 and 369 of the green document, and then language parts BBB and EEE on the purple document.
So you can tell how important our staff is to helping the committee run. Aaron, as long as you've spoken, why don't you go ahead and introduce yourself?
My name is Erin Dooling. I'm one of the legislative analysts for this committee with the Nonpartisan Office of Policy and Legal Analysis.
And we're also joined by Anna Broom.
Hi, I'm Anna Broom. I'm also a legislative analyst in the Office of Policy and Legal Analysis.
And our quite capable fiscal resource is Luke Lazur.
Good morning. So I am Luke Lazur. I am a legislative analyst in the Nonpartisan Office of Fiscal and Program Review.
And the missing clerk who's now back with us is Ms. Withy.
Morning, my name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
We're also joined from the department by Mr. Mann.
Good morning. I'm Benjamin Mann, Deputy Commissioner of Finance of the Department of Health and Human Services.
And by Molly Bogart.
Morning, Molly Bogart, Director of Government Relations for DHHS.
And Jeff Wiley has just joined us.
Good morning, I'm Jeff Wiley. I'm the Budget Director for the Department of Health and Human Services.
Thank you all for being here. So we left off our conversations at 367 through 369. The motion to deal with the prescribing fees was tabled. So I'll entertain a motion to bring it off the table for discussion.
So moved.
A motion has been made
Second.
and seconded. All those in favor of bringing it off the table, please signify by raising a hand visibly. There we go. So that carries. We'll go with that. Thank you. All right, so this is line 367, which reduces the main care prescription dispensing fee. We were going to get some language correction to that to make sure we had it exactly right in what was described about the bill. Are we there yet, Aaron or Anna?
I think I would defer to the department and Luke on this one.
Okay, Luke, do you want to fill us in?
I don't believe there was any specific language here. I think the only discussion that had to do with any sort of language was just in the justification that's on the green document. It wasn't spelled out exactly correctly. And so that was a bit of a discussion yesterday, but I don't think there was any language for this particular line.
So that box should read, this initiative will align the main care pharmacy dispensing fee with the New England average instead of the current Maine average. Is everybody clear on that? Representative Craven.
Thank you. Thank you, Mr. Chair. I just wanted to ask Mr. Mann whether family planning was included in this cut.
This is I don't believe so. This is a retail pharmacy issue. So to the extent that family, yeah, I would have to confirm that. But these are retail pharmacies. I did pull the numbers. There's 376 pharmacies across the state that that receive dispensing fees from Maine Care.
And the net impact to them is negative 4.7 million, right? Roughly.
4.8, yes.
Okay. So that puts it in the thousands category, not the hundreds of thousands. Yes, Representative Craven.
Thank you. Sorry. I guess I would really like to have a clearer answer about that, because family planning is already really, really struggling, and even a small cut would be really detrimental to them. So I just wondered if we could get clarity on that. Thank you.
Certainly.
So you'll get back to us with that information, Mr. Mann?
Yeah, I will. I think it makes sense to come back to the committee in writing with more context related to this, and we can just send the updated description or the justification language as well, so we're all on the same page with that, as well as 340B, which the proposal that you all asked for yesterday for replacing the savings that we are proposing in 340B. We'll write that up and get it to you as soon as possible.
And the impact per pharmacy on average, because there'll be a huge swing, is $12,800 roughly per pharmacy. Yes, Senator Moore.
And I guess that brings up the question as to how did we actually arrive at these savings that are being reflected in the biennial budget? Did we base that on the 376 farm? How did we arrive at those numbers?
It was a straight math calculation. We have the pharmacies submit claims to the Maine Care system, and those claims pay out at $11.89 currently. We reran it at $10.59. It generates 4.8 million state and federal in savings.
So that tells you how many prescriptions there are out there. It's a lot for $1.30 difference. Yeah. Yes, Representative Zager.
Thank you, Mr. Chair. Mr. Mann, I was wondering if you could help me understand the connection to line item 364 in the explanatory notes, because I understand from that the rural dispensing fee was originally intended to supplement general dispensing fee. And then in 2018, the general dispensing fee increased by over 300%. Can you please put the main average in the chronological context of that increase to 300%?
I can try. I think prior to 2018, the dispensing fee was $3.35. Because it was admittedly low for many years, there was a rural dispensing fee add-on that was paid to rural pharmacies to help supplement the costs that they incurred. There was a rate study conducted, and costs were determined to be higher than that, and we changed the dispensing fee up to $11.89, which is what that 300% is referring to. And now, in an effort to generate savings, given the fiscal climate when we are developing the budget, we are proposing to reduce that dispensing fee back modestly from $11.89 to $10.59, which is the New England average, and also eliminate the rural dispensing fee. I would note that the rate study that those costs were based off of did indicate that urban dispensing fees are higher than rural dispensing fees as well.
Senator Baldacci, does that answer your question, Representative Zager?
Yes, Mr. Chair, and I appreciate, Mr. Mann, I appreciate that information.
Senator Baldacci?
Thank you. Mr. Mann, so is this 1189 was how much in 2016? What was the figure in 2016? For the, like, when did 1189 get established? What year was that? And what were the rates like for the 4 or 5 years immediately preceding that?
I want to be clear. The 1189 is the average cost for dispensing in Maine, and the 1059 is the New England average cost. We aligned the Maine cost to the fee, and we were proposing to lower that fee now to the New England cost average.
Right, I understand. I understand. But the question is, what was it was set at 1189 2018, is that correct?
Yes, that's what it was increased across the board.
Okay, so my question is, what were the rates for the 3 or 4 years but immediately preceding that? I guess I'd like to have that.
$3.35.
Okay, so it was $3.35 every year, and then for 18 and 19 and 20, it's 1189.
It still is 1189. Yes.
Okay, I just needed to have some context. Thank you.
Sure.
Representative Perry.
I think I got my question answered. Thank you.
Good. Are there any other questions? So we're waiting for some information. So it sounds like it would be appropriate to consider tabling this. So I'd entertain a motion to put it back on the table.
So moved.
Second.
Been moved and seconded. All those in favor of tabling this motion, well, I guess we should do it officially with Carrie. So why don't we go back to Ms. Withy and have you run a list?
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Need to
Sorry,
see-
Representative Craven. Oh, there we go.
Yes.
Thank you. Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
Okay, so now we can go to line 347 and 49 through 49. Which is on page 22 of the Green Book. And we'll need a motion to bring it off the table.
So moved.
Second.
Okay. So why don't we just indicate by a show of hands those who are in favor of taking it off the table for discussion. Very good. Thank you. All right, so we're now back at 347, and this relates to the 340B challenges. And that Mr. Mann referenced that there was some homework to be done. Where do we stand with that at this point?
We're pulling that together. We'll get something. I think what would be easiest is for us to submit something in writing in response to the request for replacing the savings that are being generated from 340B, so the department can be compliant with what CMS expects us to do, but the providers are also the funding that they are currently receiving would be replaced in some way, shape, or form.
Okay, and it would help if we had a summary paragraph or a snapshot of what CMS has given you for feedback, and a discussion about other ways that we might be able to finance keeping people whole, and a better understanding of who would be impacted if there's anybody beyond private pharmacies.
Yeah, just to be clear, there's no private pharmacy. This is not a pharmacy issue. These are.
That's right.
There's family planning is implicated. We've been working with them. Acute care hospitals would be. Okay. We are working with CMS on critical access hospitals. Since the reimbursement for acute care hospitals is different than critical access hospitals. We cost settle critical access hospitals. We're working with CMS to determine the appropriate treatment for that. So that is something we're actively working on. And then the other piece is that is relatively small is FQHCs, federally qualified health centers.
In terms of the work that's outstanding, would it be easier for us now just to not move this into the budget and then have a new amendment come out that would clarify what we really intended? Or should we just consider tabling it and bringing it up within the next 9 days? Does it make a difference to the department?
I'm sorry, what were the option?
It seems like we have two options at this point. We can put it back on the table and wait for additional information, or we could vote to move this in or out of the budget and be done with it. If we moved it out, we could always use another amendment line later on. And if we moved it in, then you wouldn't have to do any homework.
I would defer to the prerogative of the committee on how you want to.
Yeah, and my question was, would it make a difference to the department? Was what I was asking. I don't see anybody saying it would.
I mean,
So-
the only thing that I might add is that we propose the initiative based on what we believe we need to do. And so we would ask you not to vote it out, but as Ben said, it is your prerogative to do so if you choose.
Sure, I was just trying to figure out the easiest path forward. Yes, Representative Javner.
Thank you, Senator Claxton. I definitely would be amenable to that, voting these, not moving these forward into the budget, but, voting, not voting them in, and then seeing what the department comes up with their justifications and, their paragraph format, and seeing if we wanted to therefore bring forth an amendment with that information.
So that's one option. Was that a motion?
I will make a motion to not move lines 347 to 349 into the budget.
Second.
There's a second for that. So any discussion at this point? Representative Perry?
I'm not sure what I'm voting for. This is not a vote to table, but a vote to take this section out.
That was the motion that was made. The motion on the floor is to not move this into the budget, this line, and the two associated lines into the budget. The other option is to table it and give the department a chance to work on it further, which is what Molly raises a possibility. Any other comments or questions? Anybody interested in tabling it more than voting it out? I don't see a motion to table. So the motion on the floor is to move out of the budget lines
Mr. Chairman, I'll
347.
move to table.
Who is that? Oh, Senator Baldacci. There was a motion to table. Is there a second?
I'll second.
Okay, so at that point, we'll vote on the motion to table further discussion. And I'll ask Ms. Withy to run the roll on the motion to table.
Representative Zager.
Yes.
Representative Zager. Yes. Representative Lemlin.
I'm not sure why we're not voting for the first motion before we vote for the second one. So
I think the motion, I think the motion to table supersedes any other motions on the floor.
okay, I'm a no.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 6 yes, 4 no, 2 absent.
And just to confirm, I looked it up while we were voting, and the motion to table takes precedence over continuing conversation about a motion. So I just wanted to make sure that I had respected Representative Lemlin's question, and that so hopefully that answered that. Okay, so we're making startling progress this morning. We've tabled both of the line items in question. And that gets us to language BBB on the purple document. And before we even consider that, I wanted to check in with Senator Baldacci about the status of his amendment, because that's going to impact what we do with BBB.
Thank you, Mr. Chairman. My amendment is ready to be voted on. I circulated it yesterday and ready to go forward with it.
Okay, so I'll entertain a motion to take item BBB off the table for further discussion.
So moved.
There's a moved and seconded. All those in favor? I think we can take things off the table this way. Thank you. That carries. So is there further discussion about BBB?
Mr. Chairman, I would offer my amendment
Yes,
to change the reimbursement formula to what it was pre-2013 for general assistance. General assistance is a state mandated program. By law, every single municipality has to have a general assistance program. And this language is simply to return really to make sure it's a more fully funded mandate. This is people in emergency needs of housing and medicine and medical care at the local level. They are really, the most vulnerable citizens, particularly in a pandemic. This general assistance program is extremely important in Maine's major service center communities, which are typically the largest city in each county. It's typically the one that shoulders the most burden. But I would ask for the committee's support for this. I think it will help reduce some of the pressure on property taxpayers. And I think it's the right thing to do in the middle of a pandemic to make sure we have a full safety net, particularly where this serves the poorest of the poor. The suggestion,
can you speak to how your amendment would impact BBB? Because that's the item that's on the table.
well, I think what we discussed yesterday was to just add my item, to vote BBB out, and to add my item as an amendment to it, to add it to the baseline budget. I think that was what the discussion was yesterday. And maybe either Luke or Mr. Mann can.
Yes, Senator Baldacci, I'd like to just quickly speak to that. The idea is, I think what we discussed yesterday is that if you do anything to BBB, you're impacting the overall general fund standing of the balanced budget. So I think your amendments are truly that. There were two amendments that really go together for GA that can be voted on separately from BBB. But I think then when you're doing that, you have to understand what you're voting on BBB. These amendments do not impact BBB specifically. So really, you're voting on that item on its own merit, whether you want to include it or not. The amendment really does what Senator Baldacci mentioned. And the question I have for you, Senator Baldacci, is you had also mentioned using lapse balance funds to fund this through the biennium. Is that part of what you're wanting to propose now?
No, I think from the discussion we had yesterday, I think that it made more sense to add it to the baseline and vote BBB out in a whole, and then add this to the baseline.
Okay, the problem with doing that is you're doing two completely separate things, and that's what I'm concerned about. Is I just don't want the committee to do a vote that isn't really what the intent is.
Okay.
Adding it to the baseline was the amendment that you proposed yesterday, was the language, adding the new language, which brought it back closer to what it was prior to when it was most recently changed. It's not quite back to the way it used to be, so that's why I wanted to be careful. But it brings it back to where if the municipality pays an amount equal to or greater than 0.0003% of its, and I'm trying to be careful because there's a specific way its most recent state valuation, then it gets 90% funded. If
Right.
it doesn't meet that criteria, then it gets 70% funded. So that's what the language does.
Right. Right.
And so that's one, and that's the part that we identified the cost of just under 1.2 million each year.
Yeah.
And this initiative, this amendment would add that to the baseline. It would put 1.182 million as a baseline, as a new appropriation, which would remain in the baseline. That's where I'm just saying that Part BBB has nothing to do with that. It's
Right.
just lapsing funds from general fund to help with the general fund balancing of the budget. So
Right.
that's why I'm trying to say, if you vote out BBB, you're actually creating a bigger problem than even the additional 1.2 million a year, because you're also removing 3 million of what would have been funds going to the general fund to use to balance the budget. You're pulling it back into the
Right.
general
When
assistance.
I use the term vote out, I mean vote it out of committee, vote to include it the way it is. Vote to include it the way it is in terms of the language that's been presented, approve that, and then approve my amendment and that would add it to the baseline. I think that's what we discussed. The issue about lapsing funds, I think there was an issue because we could do, that's an alternative, I guess, if people want to go that route, because it'd be more of a one-time budget issue, because it obviously wouldn't be added to the baseline. So, but at this point, my amendment is, in terms of procedure, Mr. Chairman, I will withdraw this amendment right now and just move to include BBB as part of the budget, if that makes it simpler.
There's a motion. Is there a second? Anybody want to second that motion to move BBB into the, I don't see a second yet, so we don't have an official motion yet.
Second.
Okay, there's a second. So now what the motion on the floor is to move BBB into the budget. Representative Perry, I see you.
I guess my big question is I would really like us to vote his amendment in where it belongs, and then go to BBB and whatever else has to happen that is adjusted by his amendment. My concern is this is so confusing that I feel like we're voting something in before we've actually done the work that has to happen beforehand.
Okay. So yes, Senator Moore.
I agree with Representative Perry. This is very, very confusing because we're looking at this amendment. My other question is about the amendment itself. It references reimbursements to the Indian tribes at 100%, but yet there is no fiscal note indicating that. So it's almost like it's been left off of the amendment.
No, I don't. No, I think it's included in the fiscal note, and the current rate of reimbursement to the tribes is 90%. So it's not a major change there.
Well, you're showing 100% though in the amendment.
Right, right. So it goes from 90 to 100. But
I can speak to this, Senator Moore. So I did look back at the fiscal note. This was based on a fiscal note that was done for a bill that used this exact language last year.
Right.
And when I went back and looked, the reason that there is no impact for the Indian tribes is because the Indian tribes submitted no general assistance costs during the period of time that was used in the fiscal note.
Okay.
So changing it from 90% to 100%, or changing it from 70% to 100% had no impact on them, which is why it's included in the sense that it was looked at, but there was no cost to the Indian tribes.
Because there hasn't been any GA. Okay.
In all the GA, just so you know, it's included here in the sense that all of the GA comes out of this one account. So when it notes that it's provides funding for a 90% reimbursement rate, the only reason that was included in Indian tribes wasn't is because there was no actual cost associated with the Indian tribes, but the cost for that do come out of the same account.
No, the same line. Okay.
Yep.
Thank you for that
okay?
explanation.
You okay in that particular point now, Senator? Okay.
Yes, thank you. That clear.
All right. So the motion on the floor, on the, yes, yes, Deputy Commissioner Mann, I'll get there.
Thank you, Mr. Chair. I was just going to make two comments, if I may. The first is that we looked at the fiscal for this last night, and based on more recent data, I believe the 1.18 fiscal that was introduced was based on 2016, 2017, and 2018 data. The updated, using more recent data for general assistance funding, came in at 1.685 million annually. So approximately 400,000, a little bit more annually, general fund. And I just wanted to clarify, I agree it's a little confusing, but yesterday we did discuss further offsetting UBF to cover the costs in the upcoming biennial based on the baseline increase. I would have concerns around the carrying balance having sufficient funds to do that. But what I just heard from you, Senator Baldacci, was that that is not the proposal, that it sounds like you all want to vote on the BBB language and then separately vote to increase the baseline cost to cover the policy proposal here. So that you wouldn't be offsetting the cost of the baseline increase using UBF. Which makes more sense to me because there's limited, while there are funds available in the carrying balance, they are limited, and GA costs are increasing. I would just also note that this is a fairly significant policy change. So I don't know. We're evaluating the impact of it after just hearing about it yesterday.
Thank you, Mr. Mann. You used the term UBF, and I just want to make sure that we're all on the same page. That's the first time that's been used.
I'm sorry.
Unencumbered balance forward, right?
Yes, very good.
Just want to make sure we're on the same page, right?
I try not to speak in acronyms. Sometimes I slip.
I know, it happens. Yeah. All right. So the motion on the floor right now is to move BBB into the budget. The options at this point are to vote on it or to table it again and then consider Senator Baldacci's request amendment first.
I'm happy to go forward with my motion, Mr. Chairman, just because I think the procedure after hearing from Deputy Commissioner Mann is, so I'm still offering my amendment after this is.
Yes, that part. Yeah. Okay. So you want, so you proposed, you're the source of the motion to move the BBB into the budget.
That's
and
correct.
It's been seconded. Are there any questions about that? That's what we're voting on, moving BBB into the budget. All right. So I don't see any further discussion. And so we'll defer to Ms. Withy about counting the vote.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
I'm sorry, Representative Perry, could you please turn your video on for the vote?
Oops, I'm sorry. Yes.
That's okay. Thank you. Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 4 no, 2 absent.
Thank you, Ms. Withy. So Senator Baldacci, would you have an amendment that you wanted to bring forward?
Thank you, Mr. Chairman. I would offer my amendment that has been circulated to the committee and discussed to raise the state reimbursement of general assistance after it reaches the 0.003% level stated in the statute. I think it's an important move in the middle of a pandemic. I'm not surprised that local budgets have been strained even further.
So there's a motion on the floor. There's a motion on the floor. Is there a second?
Second.
I hear a second. Okay. Did anybody would like to speak to the motion? Please feel free. Did you have something else you want to add, Senator?
Yes, I just wanted to indicate that it's no surprise in the middle of a pandemic that local budgets have been strained. We are there to begin with. I believe that any increase that we approve is more than likely in the final analysis going to be coming out of federal CARES funding, either that's already been approved or that is likely to be approved, because most of these increased costs have to do with dislocation of people, housing and medical during this emergency. But in any event, I understand what the department has said, but having been a city councilor for 12 years, having worked on local issues for a long time, having been mayor, I know how important every dime is to a municipality when it's putting together its budget, so that it's trying to limit whatever the property tax is, the burden on homeowners. So this is another piece of trying to be able to, one, have a state mandate, making sure we give money to the localities that are having to comply with the state mandate, and helping really the poorest of the poor, and still trying to, help municipalities not strain budgets when they should be spent on infrastructure or police or fire or other services as well. Thank you.
Luke, you had your hand up.
Yes, I just wanted to ask, it was discussed yesterday about me sending my information to the department so they could get back with some additional information. And Deputy Commissioner Mann did note today that they would propose that the update be for 1.685 million as opposed to the 1.18 million. And I just wanted to make sure which way you want this amendment to go, so that I have it correct.
Well, I would ask that go for what the commission feels is the legitimate number. So that would be the 1.68 at this point, I believe.
Yes.
685. Okay, Senator Moore.
Yes, thank you, Senator Claxton. Having served as the mayor of Calais myself, Senator Baldacci, I understand the dire straits that we get into in our cities and our towns for our general assistance. And I can't say more about that, but I feel like right now is not the time for us to jump this back up to the 90%. I think we've been budgeting it at 70% of our GA, in the budgets across the town. If we get some additional CARES fund, perhaps we can help out the cities in that regard. I am just not ready for us to spend another 1.685, as far as our budget goes with the revenue shortages that we're facing. I cannot support the amendment. Thank you.
Are there any other comments related to the motion on the floor, which is to increase the GA compensation to 90% at the threshold? I don't see any comments. So why don't we start the vote, Ms. Withy?
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
No.
Representative Griffin, no. Representative Connor, Representative Connor is absent. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan, Representative Madigan is absent. Representative Javner,
No.
Representative Javner, no. Senator Moore,
No.
Senator Moore, no. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 7 yes, 4 no, 2 absent.
Okay. So that gets us to line EEE. Is there any appetite to take that off the table? What's the homework that's still pending on EEE?
There is none.
No, no homework. Okay.
I would move to take it off the table, Mr. Chairman.
Second.
And a second. So the motion is to move EEE off the table and into the committee for conversation, for discussion. All those in favor of taking it off the table? Very good. Okay, yes, Luke.
So I just wanted to make a note that when we discussed this line, I also noted that the way it's phrased in the language part is incorrect. It says to lapse funding from the medical care services general fund account, and that should be the medical care payments to providers general fund account. So if the committee decides to vote this in, I would propose it's voted in as amended so we can change that language.
Will you accept that as a friendly amendment, Senator Baldacci?
Yes, I would.
Thank you. So the motion on the floor is to move EEE into the budget with the language change that Luke just highlighted. All right, any other discussion? Any questions? They don't see any. So Carrie, if you could run the vote.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
No.
Representative Lemlin, no. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
No.
Representative Griffin, no. Representative Connor, Representative Connor is absent. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan, Representative Madigan is absent. Representative Javner,
No.
Representative Javner, no. Senator Moore,
No.
Senator Moore, no. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 7 yes, 4 no, 2 absent.
Okay, that brings us to some language reviews, Aaron.
Sorry.
Does that bring us to some
that-
language reviews? Yes.
Yeah, sorry. So there's related information related to lines 325 to 326 on the green document, which relates to Medicaid estate recovery. That information was emailed last night. It's LD to the committee amendment to LD 1954 from the 129th legislature. Don't know if you want me to share my screen or if you have that in front of you.
Sure. Why don't you share your screen if you would?
So this amends the statutory language about estate recovery to provide that it would only would not apply to nursing facility services or home and community-based services, including hospital and prescription drug services.
All right.
And we're just looking at the language in section 1 here. This amendment obviously also had an appropriation section, but that's not related to what we're doing this morning.
So there is also legislation this session to address the Medicaid main care liens. That sounds like this too. Is that true?
I think that they're related in some respect, but different. I honestly haven't dove too deeply into that bill because you re-referred it. But this is directly tied to accomplish, I think, the initiative justification from the budget line items.
And
And
this
if I'm wrong
align-
about that, I hope Luke or Deputy Commissioner Mann can correct me.
And this aligns with federal is the intent.
That's correct. This would align to the federal minimums for estate recovery. Currently, we are recouping and clawing back additional funds from members if they are owed to the department, and this would stop that practice and only recoup funds for debts owed in alignment with the federal minimum requirements.
So this, Aaron, could reasonably be included in the vote on the language of that line? Or is this better as a standalone language acceptance?
I think you could vote it in. I mean, you've already voted this line. You could choose to revote this line as amended with the language, or you could keep that line voted in and you could decide whether or not to vote in this language separately. I don't know if that seems like a distinction without a difference.
Yes, Luke?
So my thought on that is, if you think about the way we're voting these items in, Part A is its own thing. So the actual initiative that you already voted in is in Part A. This language is going to go elsewhere in the budget anyway. It will just be in the language parts. So there's no need to really tie them together. So you can just vote the language in and it will end up as it'll be additional language that the HHS committee is proposing to put into the budget as its own piece of language. And that would accomplish what you're trying to accomplish.
Okay. Any other questions about that? Any comments? Yeah, Senator Moore.
I don't have any comments. I would make the motion that we add this language into the language portion of the biennial budget.
Second that.
And motion's been made and seconded. Is there any further conversation about that amendment or that motion? So it looks like we're getting ready to vote there. So why don't you run the list, Carrie? Thank you.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes.
Thank you. So the last piece of language under consideration would be related to line 269 and 70, the Mortality Review Committee.
Would you like me to share my screen for that?
Sure, if you would, Anna.
And I would just add that Director Sosay is going to join us shortly to be available for questions.
Okay.
Okay.
So I want to address the issue that you got by email last night. So this is to establish this aging and disability mortality review panel. For those of you that have been on the committee, you'll remember this, but for those of you that weren't, this was related to the OIG investigation a few years ago. So this would set up a board that would look at all the deaths that happen in home and community-based services. And the definition of adults receiving services there references the under a waiver granted by the US CMS in accordance with 42 CFR Part 441. At first, we thought that it was necessary to make an addition to this language to include the 1915K that the department planned to apply for, but we realized that that is actually already included in Part 441. So the recommendation is actually just to make this language even simpler and say adults receiving services means adults receiving home-based and community services. Lost my piece of paper. Under 42 CFR 441. So that way you pull in all the waivers and all the state plan amendments. So that's the only change to this language that we are aware of. But that was the recommendation from Paul that we sorted out this morning. We realized that the email we sent you last night was actually incorrect.
To unshare your screen. Anybody have questions about that before Anna unshares her screen? Thank you. I just have to see who all is here. Long as Mr. Saucier is here, why don't we bring him in and ask him if he has any other comments he'd like to make related to this? Welcome, Mr. Saucier.
Thank you, Senator. Good morning.
So you brought us some new language, or worked out some slightly different language, and any comments about that?
No, I did hear Anna just present that language, and it's just because also in the budget, we have a new state plan option for HCBS that the governor's proposing, and should that pass, we want the language to include that as well. It would be the same services under a different federal authority, and we would want those folks to also be, the deaths of people in that program to also be reviewed.
Okay, and you're comfortable that the language accomplishes all that you want to meet those expectations?
Yes, it would, yes.
Okay. Any comments or questions for Mr. Saucier about this language? So I assume it works much the same way, Luke, that if we accept this language, we don't really need to vote on it as a separate line reconsideration. It'll go where it needs to in the budget process. All right. So I would entertain a motion to approve the proposed language.
So moved.
Seconded.
I hear a moved and seconded. Any further discussion? Okay, so looks like it's your turn again, Ms. Carey. Thank you for being here, Mr. Saucier.
Thank you.
That's a short engagement.
Perfect.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry, Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
Okay,
Can
There
I
we
just
go.
make one more comment about this, Senator?
please.
So I just want to bring to your attention, and we'll figure this out later, that this language has a public records exception that needs to be reviewed by the Judiciary
Judiciary.
Committee. It's not entirely clear in this particular case which committee will do that, because it's technically the AFA's budget, but this is kind of your bailiwick. So we will work that out with you and with the chairs of the Appropriations Committee, who will exactly do that, but it's the same language as you did 2 years ago, so it should be fairly straightforward. But I just want to make sure that, I just want to bring that to everybody's attention, that that will have to take place.
And was that reviewed 2 years ago in Judiciary?
It was, but it's a new committee, so we have to do it again. But
No,
we
I
can
under- I
reuse the
understand.
letter.
I
We can
understand.
reuse the letter. That's the best part, Senator.
Oh, boy, oh, boy. All right, so there's still a little work there. And the outstanding work on the rest of the budget is related to amendments. And I think that work is still ongoing. Am I correct? So we don't want to close out that effort. Now that I have a better sense of the calendar than I did early yesterday, we aren't under quite this constraints, and we'll work with the leads this afternoon to come up with the next work session for the budget. Are there other agenda items that people want to bring up? I don't see anybody with a particular thing. And as far as the analysts go, we're all set. I see one nodding head anyway. Okay. So at this point, I guess we entertain a motion to adjourn until 1 o'clock.
So moved.
Second.
Second.
Moved and seconded. All those in favor of adjourning until 1 o'clock, please so signify. Again, thank you, Deputy Director Mann, Mr. Wiley, and Luke for your support. And thank you, Mr. Saucier, for joining us.
Thank you.
See you at 1.
Hi, Anna.
Hi, Margaret.
How are you?
I'm all right.
Do you still go out horseback riding and get out?
Yes,
the house?
actually, I've been doing a lot of barn chores at the moment too. We've had an all hands on deck situation at the barn for a while.
You need to keep that stress under control.
Are you still connected, Carrie? Did they fix the issue? Okay. Good. Nice to have you be able to join us, Representative Connor.
Well, it was nice seeing you earlier this morning in the other committee, and it's good to see you again in this wonderful committee. Representative Perry, I could say the same for you as well. It was great seeing you in the other committee.
We seem to cross over a bit.
Yeah, we seem to overlap a little bit.
Yeah.
I still think he deserves a badge of honor for being on HHS and HCIFS.
Yes.
I want to know who got upset at you in the past.
I often wonder that. I didn't know what I was getting myself into, but I am thoroughly enjoying both.
You're learning a ton, I'm sure. So I do appreciate that red light in the background. I can much more easily see your hand. I hope anybody else who shares that room with you doesn't mind. 1, 2, 3, 4, 5, 6. So we've hit the quorum. We've got our analysts here. We've got our clerk. Okay. So it being 1:01, we'll get started. Welcome to this afternoon's session of the Joint Standing Committee on Health and Human Services. We'll be working on 6 bills this afternoon that we have previously heard in public hearing. So we will not be inviting testimony, except that for those people who are currently or will eventually be attendees, we may invite them in to help us clarify some issues as we go through the list. You can watch this on our YouTube channel. So go to legislature.maine.gov, look up Health and Human Services and click on the YouTube link, and you can listen and see what's going on if you'd like. This is also recorded, so you can get to it later on if you'd like. We had a few more electronic challenges this morning, but we've ironed those out. And that's typical of where we are in our learning curve. Things like that pop up. So please be patient with all of us while we sort things out. One of these days, we're going to start counting the number of people who start to talk while they're still on mute, and give out a booby prize. I'm always being reminded about that. So I didn't have my phone off this morning, but I got lucky. It's off now. And we can't use the chat box unless you have a procedural question or concern about how the committee's going. So we'll start there. And then if you do join us, please make sure that the name that's on underneath your photo matches with who you are so that we can know who you are. Let's start with some introductions and begin with Representative Zager.
Good afternoon. Thank you, Mr. Chair. I'm Sam Zager. I represent District 41 in Portland.
Representative Lemelin.
Good afternoon. I'm Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and half of Nobleboro.
And Representative Stover must be coming. Wait a minute, I gotta expand my view. I don't see her. Okay, Senator Baldacci is next.
Hi, I'm Joe Baldacci. I represent Senate District 9, which is the city of Bangor and the town of Herman. Thank you.
Representative Perry.
Good afternoon. I'm Ann Perry. I represent House District 140, which includes Indian Township, Baileyville, Bering, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
And Representative Griffin's here. Yeah.
Good afternoon. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Candaskeg.
And Representative Connor has joined us this afternoon.
Thank you, Mr. Chair. Hello, my name is John Connor, and I represent House District 58, which is part of Lewiston.
Representative Craven.
Thank you, Mr. Chair. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Madigan is presenting a bill in another committee. Representative Javner.
Good afternoon. I'm Representative Kathy Javner, and I represent House District 141, which is located in Penobscot and Washington County. And I apologize for the lighting of I don't know what's going on.
You look like you're in a witness protection program. Senator Moore.
Good afternoon. My name is Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Thank you, Mr. Chair. I am Representative Michelle Meyer, serving Southern Maine's House District 2, which is parts of Kittery and South Berwick and all of Elliott.
And I'm Ned Claxton. I serve the folks in Senate District 20, which is Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. We're ably assisted by our legislative team. Ms. Broom.
Hi, I'm Anna Broom. I'm one of the legislative analysts, and I work in the Nonpartisan Office of Policy and Legal Analysis.
And Ms. Dowling.
My name is Erin Dooling. I'm one of the legislative analysts for the Office of Policy and Legal Analysis, and our office doesn't take positions on or advocate for legislation.
And Ms. Withy.
Good afternoon. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
And we're also joined by, yes, Representative Connor. Nope. Okay. And we're also joined by Ms. Bogart, who's been a resource for the department.
Hi, I'm Molly Bogart, Director of Government Relations for DHHS. I think I'm still here from the morning, but we'll be popping in and out to help with the next couple of bills. So thank you.
Okay. Representative Connor.
Thank you, Mr. Chair. If you'll permit, I'd like to register my votes from this morning's votes that I missed.
Is that something we can do? Look to the analysts to see if those votings are still open? Yes, fine. Be glad to have you register that. Who's got the list and who wants to go first with clarifying Representative Connor's vote?
I have some of them. We might have to tag team it.
Okay.
It looks like line 502, which is the 3 million lapsing unencumbered balance from GA.
Is that, I apologize. I have language BB.
Yes, BBB, sorry, yes.
BBB is a no.
Yeah. Yep.
Language EEE is also a no. I have, I believe it's Senator Baldacci's amendment. That is also a no. I have the language from line 325.
Is that the Medicaid language? The Medicaid recovery language?
That's right.
Yeah,
I believe
that's the
it
state
is.
recovery.
That vote is a yes.
Mm-hmm.
And then the last one that I have is the Mortality Review Committee language. That one also is a yes.
That's all of
A
them.
lot
I believe.
easier. A lot easier to do it that way than it is to do the paper version of that. So thanks for speaking and getting that done.
Thank you.
Thank you, Mr. Chair. That's all.
Great. Anything else we should do before we start working our way through the list between starting with LD 93? So I turn it over to the analysts.
Do you want to announce the entire order, Senator?
Yes, the only thing we're gonna, yes, okay, 93, 98, 121. The only real change is we'll next do 335. And we'll save 265 and 372 for the last two. Is that okay?
Yep.
All right.
Is it all right if I share my screen to start with LD
Please.
93? Okay. So I just have to find the right one, of course. Here. Can you see LD 93?
We can.
Excellent. The system works sometimes. Okay, so this is LD 93. This is an act to improve Maine's quality rating system for childcare services. This is a department bill. This bill removes the language that requires a 4-step quality rating system for childcare providers, which is what we currently have in law, and instead allows the department discretion in setting the appropriate number of steps with a minimum of 3 steps required. So you heard from the department during the public hearing that they intend to move to a 5-star system. And so they're looking for some discretionary language because the current statute requires them to have a 4-step system. And you also heard the pilot of the 5-star system called Rising Stars for Maine. There was a suggestion, I believe from you, Senator Claxton, of removing the language about what the rules require and leaving it up to the department. And there was also a request for other quality standards to be included in the current law. So in terms of drafting, the statute, I think that the statute is probably already sufficiently flexible in terms of nationally recognized quality standards. This is the last bullet point under the issues. It says such as those standards required by. So I think that that does allow for room for more than the 2 types of standards, which I'll show you again at the end. And then section 3737 subsection 2, which is the part you're looking at, establishes differential rules for quality childcare and authorizes rules. You could choose to remove the language requiring the rules to include a rating system with steps if you wanted to. You did ask about the report that was referenced by, I'm sorry, Dr. Landry. And we have, I sent, obviously you can't look at them right here, but we sent them to you last night if you wanted to look at the 2 reports, one which was the big report and then the one relating to the pilot report. And then you also asked for the department's response to the suggestion about nationally recognized quality standards, and the department also agreed that the language is sufficiently flexible, that they don't believe that it's necessary to change the statute for that particular issue. OFPR preliminary fiscal impact statement, or that should say no fiscal impact, I'm sorry, that's a typo, and no fiscal note is needed. And I just put the current statute there again, if you wanted to see it, so you could see this is the Head Start or the National Association for the Education of Young Children, that it does say such as those standards. And also I just wanted to see that if you did decide to go down the road of removing the language of the steps instead of changing it the way it's drafted in the bill, that you would just strike out this last sentence of the first paragraph, if that's where you decided you wanted to go.
Okay. So thoughts about LD 93 based on what we just heard from Ms. Brum? I'm inclined to prune statute as often as we can, do it reasonably as opposed to expand, especially if it's unnecessary. So what would the folks feel about eliminating that last sentence in the paragraph that she just showed us? Yes, Representative Jabner.
Thank you, Chair Claxton. I'm definitely amenable to that. I think that's prudent.
Okay, thank you. Any other thoughts before we entertain a motion about the idea of taking advantage of the flexibility that's already in the paragraph? I don't hear lots of discussion or lots of concerns, so I'll entertain a motion Yes, Representative Craven, did you have a?
Yeah, I would move in as amended.
I'd second.
There's a motion and a second. The amended version that's been proposed strikes the last sentence to leave flexibility for the department to set up a grading system so they can go to a 10-point system in 3 years if they want to without having to change status. So any further discussion before we get to Ms. Withy? All right, Carrie, could you run the list?
Representative Zager,
Yes.
Representative Zager, yes. Representative Lumlin,
Yes.
Representative Lumlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan, Representative Madigan is absent. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 12 yes, 1 absent.
Okay. So next we'll go to 98, LD 98.
All right, I just have to find my right screen again. Where is my right screen? Here. Okay, can you see LD 98?
We can.
Okay, good. So this is a little bit difficult to read. Well, I tried to make it as simple as I could because I think the most important thing here is for you to understand what the bill does. So I have merged my summary and the summary and the drafting notes. So the bill makes some various changes to the laws governing the licensure of childcare providers in order to ensure consistency between provider types. And specifically, the bill does the following. The first is that it replaces all references to the certification of family childcare providers with references to licensure. So current law requires a license for childcare facilities and certification for family childcare facilities. For anybody who's new to this committee, the family childcare providers are the ones, the little ones that have up to 12 children, and the other childcare providers are larger than that. So this bill would use the same type of, would be a license for both of them. Secondly, the current statute specifies that the rules for childcare facilities includes a paragraph F, quality of the program, and paragraph H, administration of medication. And in this bill, sections 22 and 23 of the bill include those same things in the rules for family childcare providers as well. And then sections 3 and 4 of the bill change the current statutes on violations, allowing the department to levy civil penalties against those who violate statutes or licensing rules governing childcare facilities. The bill, and I'll show you this again a little further down, the bill repeals subsection 3 with the violations of licensure and moves what was in that section into the civil penalty section in subsection 2. That cites the same, currently cites the same section that generates a violation and applies the same fine language for the civil violation as violating child staff ratios. So you can, whoops, sorry. So you can see the current law. You can see at the bottom here, this is the current law where it says the civil penalty section. This is the section that is being amended. And then you can see this section 3, the subsection 3, all of this is getting moved into subsection 2 and then applying the fine. So you heard from some of the testimony that the department told you they were out of compliance with the federal block grant, and that this bill would codify those components, and they need to change the law to implement rules so that they can go forward with their rulemaking that they need for compliance. And then you heard some testimony on both sides about rules on quality being included in the rules. You heard about positive impact on children. And then you also heard that it was subjective and exacerbates the loss of childcare spaces. So there were some additional information requested. The first relates to this compliance issue, because if you go back and if you're like me and you get a little confused and you go back and look at the $800,000 penalty that we heard about, the letter that this committee received prior was related to background check compliance. So I asked the department about that, what the compliance issues are in this bill. And you can see here, this is the answer that we got from the department, that updates are required to the rules governing childcare providers in order to bring the state into compliance with this is the block grant requirements. The background check issue has been resolved, but if we fail to amend our rules to ensure compliance, we risk a penalty on areas where our rules are out of compliance. We are in the process of drafting and promulgating these new childcare provider rules, and the changes proposed by LD 98 were identified by the Attorney General's office as areas of the statute in need of change in order to implement the rules required under the CCDGP. Try saying that quickly. For instance, the Office of the Attorney General pointed out that the statute doesn't extend the same authority over certificates as it does over licenses. And OCFS would like to continue to include family childcare providers within the childcare subsidy program. To do so without penalty requires rules that comply with the block grant requirements, and their legal counsel advised us that in order to promulgate these rules, statutory changes are necessary. So that's the question about compliance. And then the second issue, the second piece of information that you requested was the updated numbers of childcare spaces since July 2020. I'm hoping that Molly can leap in if you have some specific questions about this. So I sent this to you yesterday. Hopefully you were, I realize it was late. Hopefully you have a chance to, had a chance to look at it if you were interested in this. So you can see the response here. This should have also had little quotations around it, I'm sorry. The letter in the linked testimony, that was the one that referred to the July numbers. You can see which reflects a significant drop in total available childcare slots statewide. This fact sheet fails to note that the July 2020 data was provided to Childcare Aware specifically in response to a request for childcare provider data as it related to the pandemic. By selecting a single point in time during the pandemic, the numbers skewed lower, both because of temporary provider closures related to the pandemic, and also because a portion of childcare providers operate on a schedule similar to schools, which means they're not open in the summer. One of these links didn't work today, but it did work last night, so hopefully you clicked on the links last night. OCFS provides regularly updated reports on the number of childcare providers on its dashboard, and it goes up to February of 2021. The data is specific to the total number of providers and not slots, and it says that we believe this is the best representation of the availability of childcare providers, given that the number of slots fluctuates based on the time of year. And then they have this nice picture, and I was very proud of the fact that I was able to paste it in. Don't ask me anything about it because it's not my data, but I was pretty happy that I was able to paste it in. But Molly is here and she sent this to us in response to the questions that I sent. So she can presumably answer some questions related to that. And then the fiscal impact, preliminary fiscal impact statement, there is a minor cost increase, general fund, and a minor revenue increase, general fund and OSR, that's related to the violations. We don't get a lot of correctional and judicial impact statements in this committee on our preliminary fiscal impact statements, but we get one on here, and it says the additional workload associated with the minimal number of new cases filed in the court system does not require additional funding at this time. The collection of additional fine and or fee and revenue will increase general fund and dedicated revenue by minor amounts, but there is no fiscal note needed. So that means that if you were to go forward with this, you wouldn't need a fiscal note. I just put in the cross-reference there because I don't like not being able to see cross references. That's just so that you can, if you are not familiar with civil violations, you can see the civil violation. This is the cross reference, the general one. And then I did also include, just so you could see, if you were interested, that there are some violations with fines in the rules right now, just so you, in case you wanted to compare that. So I will stop sharing my screen and mute myself.
Thank you for that analysis. Does that answer everybody's questions about it? Do people have comments, concerns, questions for Anna or Molly? Yes, Representative Javner.
Thank you, Chair Claxton. I do have a question for Molly. Dr. Landry, in his testimony in the public hearing, alluded to the fact that some of the family child care providers had a bit of issue with some certain parts of this bill. And so I'm wondering if Molly would be able to bring some light to what some of their concerns were.
Sure, and I might ask that you move Todd over from the attendees, because he can certainly better speak to those than I can.
Sure, that's fine. I'm sorry. Didn't see he was out there. Welcome, Dr. Landry.
Thank you. Happy to be here. So to answer your question, and just for the record, I'm Todd Landry, Director of the Office of Child and Family Services in the Department of Health and Human Services. So to answer your question, we did have some questions from our family providers, specifically as it relates to some of the specific provisions that were in there. It was really nothing related to these provisions that I was referring to. It was about the background check pieces of that. And once we explained and pointed out to the fixed federal code and requirements about the requirements for those fingerprint background checks, while some of them were not necessarily happy to have to do the fingerprint background checks, it's my understanding that they all understood why the state was moving in that direction, and they understood the need to do so to avoid future penalties.
Thank you very much, Dr. Landry.
Representative Craven, you had your hand up a minute ago.
Thank you, Mr. Chair. I was just struggling a little bit with the, with the amount of closures that there were during the summer and because of COVID, and just I'm expecting that a lot of those childcare providers will open up once it's safe to do so. And I wondered if Dr. Landry or Molly had any kinds of feedback about that.
Yeah, absolutely. I'm happy to provide that. The chart that I believe was quickly referenced that we provided is the latest chart on the percentage and number of childcare closures. So if you, when you look at that chart, it is from the perspective of closures. So in that case, a lower number obviously is better. We did see at the very beginning stages of the pandemic, about 50% of our childcare providers did close. The state did not require them to close. It was purely a voluntary decision on their part based on their own unique circumstances. About 50% of them did in fact close. By the summertime, by the middle of July, August, that number was up to about, or the number of closures was down to about 20% that were closed. And then beginning in the fall, in August, September, we got to approximately 90 to 95% that were open, meaning 5 to 10% closed. And those numbers have stayed exactly the same in that range since September of last year and are currently still the case. So specifically as of last week, 93%, I believe, of our providers are open, representing approximately, I believe, 91% of total capacity in the state. So we did see that rebound just as you would have predicted. The biggest part of the rebound happened in the early part and into the summer once PPE began routinely available, and as we were able to funnel federal support and relief dollars to providers to help them to reopen and to stay open. And so we saw that first wave of openings that happened in the middle to late summer. And then the big second wave happened in September when many of the programs that operate on a traditional school calendar reopened as well. Again, we still do have about 7 to 8% on any given week of providers that are closed. That's generally due to whenever they have a positive COVID test, positive COVID situation of a staff member or a child in their provider or in their setting. Typically, many of them choose to close for a short amount of time in order to do contact tracing, testing, and appropriate cleaning, and then they reopen. So we kind of have that revolving kind of number of those that are in that situation. I can tell you in total across the state, I believe our latest number is around 11 or 12% of our providers across the entire state have had at least one instance of at least one positive test in their facility. And so as a result, they sometimes have these short-term closures that we're continuing to see. Hopefully that answers your question.
Thank you. I was reading the chart backwards.
It's one of those rare charts. We probably should have done it from a strengths-based perspective, but when we were putting it together back in last March, I think we were thinking of closures as opposed to openings. So I recognize that that's a bit confusing potentially.
Are there other questions for Dr. Landry? It's a little bit off, it's not directly related to the bill, but what kind of changes do you think we can see in the next 6 months or so that would continue to promote the growth of the numbers of slots since we started the whole process behind anyway?
I think what we're going to see is two things that are happening. One, as many of you know, through President Biden's directive and the governor's alignment with that directive last week, childcare providers like public school teachers, or school teachers, I should say, are all eligible for the vaccine currently. And we have provided guidance with CDC, Maine CDC, to push out information regarding that. So I think as our childcare provider staff become vaccinated, that certainly is going to potentially help reduce the number of infections in those facilities from the staff perspective. Children, of course, there are no authorized emergency or otherwise authorized vaccines for children, so it will be a longer period of time for them. But I anticipate what you're going to see is with childcare providers having access to the vaccine, my hope is that you're going to see more of them able to stay working on an ongoing basis because they don't have any positive infections. The other thing I think you're going to see is probably it's going to be easier, we believe, for many of those providers to be able to hire staff now to fill any vacancies from a workforce perspective. By hiring those vacancies that they may have, that in turn will generate more potential for openings that they can reopen or establish. And then the last thing I'll mention is, in addition to the roughly $11 to $13 million we pushed out in federal support last year, the latest CRSA funds, the Coronavirus Relief Act funds that were passed in December, we are now in the process of pushing those dollars out. And it's a total of $30 million from the federal government. And those are specifically designed to assist providers to continue to stay open, reopen, or increase the number of slots that are available. And so we are looking forward to seeing the impact of those dollars. That does not include the current relief bill that's being debated by Congress and potentially signed by the president. That would bring even additional dollars to help us increase capacity, access, and also drive quality and workforce improvements.
Thank you for that. Senator Baldacci, did you have your hand up a minute ago?
No, I'm all set. Thank you.
Okay. Are there any other questions for Molly or Dr. Landry? So I'd entertain a motion on LD 98.
I would move, Mr. Chairman, to approve LD, or ought to pass LD 98.
Senator Moore, you had your hand up.
I would second that motion.
All right. Is there any further discussion? Then it's to you, Ms. Withy.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lumlin.
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 13 yes.
So thank you for being here, Dr. Landry. We'll look for reports in the future about how we're doing to grow our capacity. Hopefully you're successful. All right. So that brings us to LD 121.
Okay, can you see LD 121? Hopefully you
Yeah.
can. All right, batting 100 here. Okay, so this is an act to require a background check for high-risk healthcare providers under the Main Care Program. This bill requires main care provider applicants who are called high-risk providers or who are in high-risk provider categories to undergo criminal history background checks. High risk in this context is determined in routine technical rules. The background check must include criminal history record information from the main criminal justice information system and the FBI, as well as a fingerprint background check. The subject of the criminal history record may obtain a copy of that criminal history record check, and the criminal history record information may be used by the department to screen the provider applicant. The information is confidential and only to be used by the department for official use, and the department shall adopt rules in consultation with the State Bureau of Identification. So you heard from the department that the ACA requires fingerprint criminal background checks for high-risk Medicaid providers when enrolling in main care as a provider. And those providers are defined in federal regulations, and they were in Bill Logan's testimony. And so the providers, there are the categorical ones, which are the home health agencies, durable medical equipment, Medicare diabetes prevention programs, and opioid treatment programs that have not been fully or continuously certified by SAMHSA since October 2018, as well as any provider who becomes high risk. In other words, there's been something that's actually happened that has made them high risk, and the risk is for fraud, waste, and abuse. The background check requirement applies to the owner, not everyone who works for the provider. And you also heard from Bill Logan that the deadline was July 1st, 2018, and that the Office of Main Care Services is currently non-compliant, and the department is currently drafting rules. So I have a couple of questions here about the drafting, which you may wish to engage the department on. So the bill requires a background check, and it specifies what should be checked, who should pay, and the confidentiality of the information. Paragraph E states that the department may use it for screening applicants. A lot of this language that in the bill looks very similar to the language for childcare providers, except in the childcare provider statute, they're required to pass a background check. This language appears to be more flexible. In other words, the department, that the providers have to, there has to be a background check conducted for the provider applicants, but it says that the department that the information may be used by the department for the purpose of screening that provider applicant. That may exactly be the intent, but you may want to ask about that. And you heard about this with relation to the budget this morning, that this has a public records exception review that will be required by the Judiciary Committee if the majority of the committee supports the bill. Paragraph F creates information obtained pursuant to this section is confidential. So it creates a new record that is confidential, that is then made confidential, which is what triggers the public records exception. So that's just another thing you have to do. It's not really a drafting issue. It's just a reminder that this is part of the process if you move forward with the bill. You did ask if the draft rules were available from the department, and you have the answer right here. That they're working on them, but you can't have them. The rule is currently in the APA process. It was drafted, sent to the AG's office for pre-review, and policy just got back the pre-review memo 2 days ago. That's probably 4 or 6 now, since Molly sent me that email. And the Attorney General has consistently advised the department that once the APA process has started, the sharing of the rule and the receipt of comments on the rule should only be by the public notice and public comment processes within the APA. So it's being drafted, but you can't see it. And then the preliminary fiscal impact statement from OFPR. There's a one-time general fund appropriation of $23,579 in fiscal year 22 with an FMAP match. And that's for technological changes required in the main integrated health management system. So that's a one-time charge that you can't do much about. Additional costs to the Department of Public Safety associated with performing the background checks can be absorbed within existing budgeted resources. There is a fee for that background check. And so a fiscal note is needed.
Thank you for that. Senator Baldacci.
I think it might be helpful to have the department people come in. One of the issues that Ms. Broom identified in her memo was about may versus shall, and that and how it's going to be used. If we're going to go through this entire process, it probably should say that it shall be used in the background check. But I guess we should hear from the department as to why it's worded the way it's worded.
So we're joined by Mr. Logan, who testified early when we had the public hearing. And between him and Molly, we ought to be able to get an answer to that question or any concerns that people have. Any response? Welcome, Mr. Logan. Any response to the analysis that you just heard from Anna? Any things you'd like to highlight or address?
So I think, and I think I got when you transfer over, I got caught off and missed the last part of Senator Baldacci's question, but I think he was honing in on the language may versus shall, and whether that should be changed. And I think I'm fine with it with a shall. I mean, the ACA language is clear that we have to do this for these certain types of categories. So I have no problem with that. Suggested
Does that
change.
address your concern, Senator Baldacci?
Yes, yes. I just think it would be appropriate to put shall there so that it's not a discretionary issue, since we're all going to this effort to make sure that background checks happen. We don't want somebody to say, well, I guess we don't need it. It's up to some staff person. So I want to make sure it says shall. Yeah. That would be my amendment. My friendly amendment, hopefully.
Everybody okay with that? All right. How about other questions for Molly or Mr. Logan related to this bill? So at this time, I'd entertain a motion to approve as amended, changing may to shall.
So moved.
Second.
Second.
So it's been moved and seconded. Is there any further conversation? So I think it's Carrie's turn again.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Davner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 13 yes.
Very good. So
Oh,
that
I
would take,
I'm sorry. I just want to make sure that you know
Mhm.
that I'll be bringing back a letter at some point to you related to the public records exception, and I'll share that with the committee before it gets sent anywhere.
another one of those letters. Okay, very good. So that gets us to 335, which also relates to background checks.
Okay, I guess I'm already failing the unmute thing that you were mentioning at the beginning, Senator
Yeah,
Claxton.
but you got all the visuals right, so that carries
Right.
extra credits.
All right. So this is an act to clarify requirements for criminal history record checks pursuant to the Federal Family First Prevention Services Act. This is a department bill. It is also an emergency bill. The Federal Family First Act requires fingerprint-based background checks of staff of any childcare institution, including a group home, residential treatment center, shelter, or other congregate setting. Current Maine law requires these background checks references for residential care facilities. That was enacted in 2019. This bill amends that law to conform to the federal law, providing that the background check requirements apply to emergency children's shelters, shelters for homeless children, and any group home that provides care for children. The issues from the testimony, one of the requirements of the Family First Act is implementing those fingerprinting background checks for these providers. The FBI handles the fingerprint-based background checks, and it was the FBI, according to Dr. Landry's testimony, that said that the residential care facilities term is not broad enough to include shelters, so they are clarifying the law. I could not come up with any drafting issues for you, although it would have been fun. You asked for, there was a question about transitional funding under the Family First Act that pays for only the first year of background checks for the staff of those providers. And according to the department, OCFS has allocated $700,000 of the Family First Transition Act grant funding to residential providers, including shelters, to cover costs associated with meeting the QRTP standards, including accreditation and background checks. OCFS is fully funding the cost of background checks for all of these providers for the first year, and after that first year, the cost of the background checks will be the responsibility of the providers. And we have not yet received a preliminary fiscal impact statement from OFPR.
Yes, Senator Moore.
I'm just trying to remember, what is the cost of a background check? Or the fingerprint-based background checks?
$54.
$54, okay, thank you.
As I remember, correct me if I'm wrong.
That's what Bill Logan says it was for the other bill during that public hearing.
That's what I wrote in my notes. Okay.
Me too.
All right. So, Mr. Logan, if we have this wrong, it's your fault.
Chairman, I would move ought to pass on this bill.
Motion's been made
Second.
and seconded. Is there any further conversation? Before we go to Ms. Withy, I should give Representative Madigan a chance to introduce herself since she's joined us after we got started.
Good afternoon. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
And Anna, your hand went up before we started voting.
Oh, it's only because we don't have the fiscal note yet. So I just wanted to let you know if it does come back with a fiscal note, we'll obviously bring it back for your review, but it would make the vote in ought to pass as amended, but we'll cross that bridge when we come to it.
Okay. So the motions on the motion on the floor is to ought to pass. Any further conversation? And then we'll go to Ms. Withy.
I'm sorry, Senator Claxton. Is it okay to
Yes. So the
start the
motion on
vote?
the floor
Okay.
is not passed. So now it's to you to run the table, if you would.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lumlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 13 yes.
Thank you. We're trying to juggle calendars here, and Senator Carney is busy running the budget workshop in Judiciary. So why don't we take a 10-minute break until 2 o'clock while I try and work out a schedule with her. Although I'll entertain a motion to take a 10-minute break.
So moved.
All those, and seconded, all those in favor. See you at 2. So thanks everybody for being back here after a little break. I've heard from Senator Carney, and she would like another 15 minutes to find a co-chair. She's missing her colleague and doesn't want to step away from the budget hearing in judiciary. So she's wondering if we could go till 2:15 to hear her bills. Is there any work we can do between now and then? And I will look at the analysts and see if there's something else we could do in the meantime, whether somebody wants to jump into the opportunity to present a report or whatever.
So I think that's one option. Oh, sorry, Senator Baldacci.
Yes,
No,
Senator
no,
Baldacci?
Yeah, I was just going to ask if is it possible for us to start the discussion, and then when she joins us, we can ask questions. We don't have to take any votes until afterwards, but at least I don't know if we need to wait for the discussion, or how do you want to proceed, Mr.
I
Chairman?
think the issue is that she knows how incredible our analysts are and doesn't want to miss the analysts report.
Oh, okay.
That's the one that flags the concerns often and addresses them. Yes, Aaron.
So one option is to hear from any members who might want to present their reports. Another one is that Anna or I, or maybe mostly Anna, because this is a piece of technology she understands more than I do, can orient you to the new electronic testimony portal, which we'll be moving to and adding our bill analyses and other committee-related materials to it going soon.
Can you do that justice in the time we have, Anna?
Yes, I don't think it will take very long.
And I didn't see anybody leaping up to do a report. I saw several people shaking their heads. So let's go with orientation, Anna, if you wouldn't mind.
Okay, so I'm just going to share my screen again. If I could find the right page. I got a bit thrown there.
Thank you, Aaron.
My husband's like blew through the door and I wasn't quite sure why. Let me see if this is the right one. Yes. Okay. So this is the link that we've been sending you, a link that looks like this, except that it had a date in here. So we're going to send you this link, and you should, I think that it would be worth it to you to bookmark it. So this is the page that we've been looking at for before public hearings, so that you could see what was going on. So I'm going to show, I'm just going to put a date in here. I'm going to show you the easier way to get to this, but I think this is a really useful page to be on when you have public hearings. So I'm just going to put a date in here. I'm going to put in the 3rd, and you have to put the little dashes, or, oh, whoops. I guess it wanted that date. I want to put in the 16th, which is actually a bill for Representative Lehman. So you can see here, these are all the bills that you have during the day, that day. You can see that somebody's already put up some testimony here for this bill. We are calling this the, I think it's called the electronic, what is it called, Erin? It's called the...
it's your electronic committee file.
That's right.
Or
Yes.
That's the intention of it, right. Anyway.
So this is where you want to look on the day that you have the actual public hearing, because it's the easiest way for you to look at testimony. And we can send you this link if you want to use it that way. If not, it doesn't really matter. But the point is that here you can see where all the testimony is, but it's also where eventually we're going to be putting all the other documents. So I'm hoping that you can get out of the way. Under here, can you see this page? This is from the 2nd of March. Okay, so this is one of the bills that we did today. The LD 335 is the one we did just a few minutes ago. So under here, right now, we don't have anything but testimony, but we will be posting our other documents on this page as well. And so eventually, and when I say eventually, I mean within the next couple of days, we'll also be posting our bill analyses here, anything that maybe the department sends us that we want to forward to you. It's not just for testimony, it is actually an electronic, it's like an electronic bill file. So I just show you this page so that you can sort of see what it will look like in the end. But really over here, this is the page you're going to want to look at during the public hearing. But what I really want to show you is this is the committee page that we're always trying to orient you to. So I'm going to go down to LD 590 again, which is Representative Lemlin's bill. And you can see this link to the electronic LD file. And so that links through to this same page. So you don't have to remember what date the public hearing is on. I think that's really only useful on the actual day of the public hearing, when you're actually sitting in a public hearing and you're trying to look at testimony at the same time as you're trying to listen. But the rest of the time, the easiest way for you to get to it is to get to it from the LD, from the committee page. So I'm just going to go back to where we were again and go back again. And you can click on any of these and it will take you to this electronic LD file. But what I do have to tell you is this is moving forward. So we go back to LD 335, which is the one I just showed you, and that link isn't there yet. So if you want to go back, Erin, what's the number of the bill that you had for, is it LD 24 that you had for the hors d'oeuvres bill?
Yes.
So you can see the bill analysis is on this page for a bill that you've already worked. In the future, if we go back to LD 590 again, it's going to be in here. I mean, we could post it the other way as well, but I don't think that we'll really be doing that. So
I don't think we can do that anymore.
Yeah, I think that's right. So there is this little gap. We understand that that's not ideal, that anything we've done sort of up until now, it is a little awkward, but you can see if you go back to this LD 24 again, that you can still get everything that you need. It's just that it's going to be under this link for anything you've done so far. So there's Erin's bill analysis. You click through here and you can go to the status in committee, and that gets you the public hearing testimony. So anything that you've done already is a little bit awkward, but only a little bit awkward because everything's being posted under that LD number. But anything in the future, you'll be able to just click right through, and you'll be able to click right through onto this. This is 590, and everything will be there. Now, I think that we will probably continue to largely operate the way that we did today in terms of bill analyses, where we may not necessarily post them ahead of time, but we've been trying to send them to you ahead of time so that you do have an opportunity to caucus it. But when we post them from now on, or at least sometime in this week, they will be posted on this page. But all you have to do, I mean, I'm going to send you this link here so that you can use it during public hearing days. But as long as you continue to have this page bookmarked, the committee page, and you click through the LDs, you'll be able to see where all the documents are. And this is coming from the person that if Erin handed me her phone, I probably wouldn't know how to make a phone call.
Very good. So
sorry, Erin, what were you going to say? Erin was going to say something.
So there's a few big takeaways. One of them is that electronic testimony will stop coming to you by email because of the launch of this system. And so that portal that you see with the testimony, that is updated almost as soon as somebody actually submits their testimony through the electronic submission system. So that is really the best option for you to look at simultaneously with the public hearings. And you can get to that both from the link by the date that Anna's going to send out, or if you have the LD for the public hearings that day, you can access it the same way by clicking electronic committee file. The other thing is that it's really intended to, we don't want to change your habits in the sense that like we still want you to be able to go to the committee page and find the documents you need, which is why those links are being added going forward, because we know that we've beat you over the head with going to our committee page over and over again, bookmarking it, and we don't want to undo all of that. So it should be pretty easy to find by LD. And then lastly, it should mirror everything that you would have in your hard copy folders if we were all sitting in the committee room together. So eventually, you know, as we work on bills, it'll have the bill analysis, it'll have the fiscal notes, preliminary fiscal impact statements, it'll have amendments that'll be reviewed by the committee or letters. Everything will get uploaded to that one portal. But like Anna said, it might not happen as soon as the committee meeting starts. It'll probably happen shortly after, but you can refer back to it in caucus when it hits the floor. Everything should be in there.
Representative Connor, did you have a question a minute ago?
Thank you, Mr. Chairman. I did, but as soon as I raised my hand, Aaron said the emails were no longer going to be coming, and that was my question. So
it's a beautiful thing, isn't it, Representative? It's a beautiful
That'll
thing.
happen a lot in the next few months when you anticipate a question and she's answered it before you can get it out. Representative Zager had a question.
Thank you, Mr. Chair. And Aaron, thank you to you guys and to Stacy Morang and others who have like really made this all happen. Very exciting. My understanding is that this is, we have equal access as any member of the public, right? Any member of the public will see as soon as something's been submitted.
Yeah, we're showing you the public website. The only thing that's not, you know, when we send you our bill, like when Aaron sent the bill analyses last night at 8 o'clock or whenever it was, that's the only thing that wasn't yet on the public website. But everything else you're looking at is totally available to the public. And those bill analyses do go up on the website.
Great, thank you.
Does this apply also to work sessions? Will that same display lead us to have all the documents in one place while we're doing our work sessions, or do we go back through the file to the LD?
I think you'll have to go through the LD file.
Okay.
I mean, the LD page.
It's by date of the public hearing.
Right,
Okay.
which is why
we posted under the LD, because who remembered what date the public hearing happened.
Because I looked for today's work session under that rubric and it doesn't show anything. Okay.
That's right.
All right. So I tend to think of this as the Javner Moore page that you were showing us, because they were quite specific about wanting to have the electronic equivalent of a folder that we had in the paper era, or that's we're a whole lot closer to that than we used to be. Okay. You can still keep your paper folder there, Senator Moore. So I propose that we get started with consideration of LD 265, and we'll let Senator Craven catch up with us. It's now 2:14, so if we can get Anna to talk more slowly, that'll give.
This one's me.
Oh, it's Aaron. Okay. Okay.
Yeah, we going forward, we don't usually both tend to have work sessions in the same afternoon, so you will usually only see one of us at a time. But that's why we're both kind of here today.
Okay.
So I'm going to share my screen, if that's okay.
Please.
Okay. So LD 265 is an act to provide women access to affordable postpartum care. And this bill extends from 60 days to 12 months, the period of time following delivery of a baby that a woman may be eligible for services under main care. And in order to accomplish that extension of coverage, The bill directs the department to submit a waiver or state plan amendment request to federal CMS no later than January 1st, 2022. It also provides that in the event that waiver is not granted, that the department must implement the coverage provisions using federal funds if they're allowed, but if not, still covering this group for this time period using the general fund. It directs the department to adopt its main care rules related to this coverage group no later than 180 days after receiving a decision from CMS. And that means whether the decision is an approval or a denial, either way, within 180 days, the department should adopt the rules, and requires the department to update this committee on a quarterly basis beginning in April on the progress in seeking a waiver until that process is complete. And the committee would be authorized to report out legislation related to each of those updates. Oops, sorry. You had a couple of questions at the public hearing. So this information is provided from the department. There is a question about whether main care provides a child care benefit. And the answer is that on its own, if someone's only enrolled in main care, there is no child care benefit provided under that program. But child care assistance is available through some other public assistance programs, such as Temporary Assistance for Needy Families, or TANF. And there's also the Food Supplement Employment and Training programs and the HOPE program, giving support for education and training and employment opportunities. And there's the Child Subsidy Program as well, which helps eligible families pay for childcare. And if there are further questions on those programs, Molly is available to speak about those. There was also a question about what the experiences of other states have been with regard to getting waivers from federal CMS to extend postpartum coverage. The questions included how have other states funded the program and how much did it cost? So I'm just going to jump down to that information. It's on a different page. So it looks like 6 states have applied to CMS for 1115 waivers to extend postpartum Medicaid coverage. They are different in a number of ways. Some of them only talk about extending it for 6 months. Some talk about 12 months. Some talk about 12 months after the 60 days. And some are only related to not full Medicaid coverage, but Medicaid coverage for substance use disorder and mental health services. And some have other eligibility criteria, such as diagnoses of substance use disorder. They also have various maximum federal poverty level limits. So these links here on the side will take you, if you're curious, to the applications of each of those states. And in the case of Illinois and South Carolina, the actual decisions of CMS on those applications. Under Illinois' decision, it didn't indicate a reason why it was denied, but it did say that that CMS was continuing working with the state on that waiver request. So with regard to costs, though, there isn't really an easy way to compare states' Medicaid programs, kind of like on a one-to-one basis. As Luke said, if you've seen one Medicaid program, you've seen one Medicaid program. I know we also used that phrase with regard to our workers' compensation system when I worked there. Every state is set up differently. Every Medicaid program covers different things. And so there's not an easy way to really identify what the per member per month cost would be in one state as opposed to another. But each of those applications does have detailed enrollment and cost information charts and it goes on for pages. There's just not a way to summarize that for you or to draw any kind of larger conclusion. I'm not able to do that. The other thing about 1115 waivers is that in order to get approved by CMS, the state needs to demonstrate cost neutrality, which then there's no easy way to pinpoint that if we spend this money, we save this money over here. There's a lot of variables. And Luke said that the more variables we put in, almost the more inaccurate the estimate might get, because it just becomes kind of unwieldy. And that proving cost neutrality to CMS doesn't mean that you have no cost. There's still likely a fiscal note cost, and especially in this bill, under Section 4 of the bill, that requires this legislation go into effect whether or not CMS grants a waiver, that the state would be covering that with general fund dollars. So just going back to finish up the bill analysis, you have in your electronic bill folder, the old style, the preliminary fiscal impact statement showing the costs in this year and the following fiscal year. I also just wanted to note that the federal stimulus bill that's been bouncing back and forth in Congress includes a provision that would allow states to extend Medicaid coverage to individuals for 12 months following the 60-day postpartum period. The latest text that's on their website is from March 3rd, which is the engrossed version from the House. And I just updated it just checked it rather before the work sessions, and I don't see the engrossed version from the Senate yet. So I'm not entirely sure what passed in the Senate, but the Senate did pass that bill generally on the 6th. And if I find out more information, I can update you on that, but that link will take you to Congress's page relating to that legislation.
Okay, we're joined by Senator Carney. Glad that you could get away. I hope you found another co-chair.
Thank you very much. I really appreciate all of your patience in delaying until I could be here today.
We started, you didn't miss much of the analysis portion of bill number 265. So based on that analysis and what we know of the bill, are there questions at this point that people would like to ask either of Aaron or Senator Carney?
Mr. Chairman, I would move ought to pass of this bill.
There's been a motion made.
It would be, ought to pass as amended because a fiscal note is required here.
Yep, I would move ought to pass as amended.
Okay, is there a second?
Second.
Well, it's been moved and seconded. Are there any discussion, conversation, questions before we vote? Yes, Senator Moore.
Yes, I just wanted to pause for just a minute. I know we did look at this bill last term or last session, and we're a little concerned about the cost for the 12 months, knowing that these are folks that do not qualify for main care, but if we were to extend it for the 12 months. And I think we came up with a very good, and the other thing too was the 300% of the federal poverty level. And I think we came up with a good concession or agreement where we lowered it to the 66 months and to the 200% of the federal poverty level. I'm just wondering if that's not something that would be worth considering until we get confirmation that the federal government is going to pick up the entire 12 months. So I just throw that out to the committee.
Can I just clarify something? So this doesn't change the federal poverty level that's currently in statute, which is 200%. It only changes the duration of coverage from 60 days to 12 months. I think that change was from the CHIP bill, which we hear will work next.
Okay. Representative Craven?
Thank you, Mr. Chair. My question is for Aaron. And when the new bill comes out of Congress, is that a permanent bill, or is it going to last just as long as the coronavirus benefits last?
From the latest language that I can see on Congress's website, that would be a 7-year authorization. I don't know what was passed in the Senate. I can't verify that on Congress's website. But that I believe that would allow the state to extend coverage for 12 months without seeking a waiver.
Thank you.
Yes, Senator Carney, you had a comment?
Yeah, I just wanted to follow up on what Aaron was reporting, and it's my understanding that this provision was included in the version that the Senate voted on, and I think the final vote is happening either today or tomorrow. But I guess the question I wanted to raise was, well, first of all, what it would do is it would provide federal Medicaid funding to cover this, to cover extension of benefits for a full 12 months. The program would be in existence for 7 years. It would also come into effect, I believe the federal matching funds would come into effect on January 1, 2022. And so I was wondering if, and this is probably more of a question for Aaron, but if it makes sense to amend the bill to include that as the effective date, and then also kind of remove the language related to applying for a waiver, since we're going to know probably by the end of the day today, or certainly within the next couple of days, we're going to have confirmation that the federal program has indeed been enacted. So we're in such a funny place because we're two really important things are happening at two different levels at exactly the same time.
Did you have an answer for any of that question, Aaron?
I think that would work if you wanted to delay the effective date to mirror the federal. Rita Furlow just sent me the link to the Senate document, and I'm sorry I didn't have that ready for today. Did you know if that has an expiration period? Because if this is only lasting for 7 years, in order to continue it, the department may still need to file a waiver at that point.
Yeah, you're right. I didn't take that into account. But yeah, I guess there would be no waiver needed currently in order to implement it, but there might be in the future.
Okay.
Thanks for raising that.
Yes, Senator Baldacci.
I just want to ask, I guess Senator Moore had thrown out some suggestions. I mean, is that, if it was 6 months, Senator Carney, what's your response to some of those positions that Senator Moore had put out?
I was very grateful in the 129th for the suggestion because it allowed the committee to report out a bill unanimously with the compromise at 6 months. I think the current situation is different because we've got this federal action that is occurring that's extending this benefit nationwide. And if we can act in this legislative session, we'll be one of the first states that's able to provide this really comprehensive coverage. I also think that, given the existence of the federal legislation and benefit, it makes a lot of sense for us to provide the full 12 months because that is uniformly and universally what's recommended by healthcare providers. I think I cited a bunch of them in my testimony, a bunch of the kind of organizations like the American College of Obstetrics and Gynecology. And then finally, this type of the type of healthcare that new moms can achieve with this coverage. They really need that healthcare for the first year postpartum for their own care, but especially for the care of their newborns. because it's a really vulnerable time for both the new moms and the newborns. So I would recommend keeping it at the full 12 months, particularly in light of the federal changes.
And Mr. Chairman, may I speak?
Sure.
I would unless it was going to be a unanimous report, I mean, I would probably want to keep it July 1st as well, because to begin with, it's going to take some time to get up and rolling and get the information out to people. And also because there's the cost for that 6-month period is going to be relatively low compared to what the state will have for resources and does have for resources in the main care program. So unless the sponsor wants us to go with January 1st, I don't know if Senator Carney wants us to go with January 1st or not, but I'm inclined just to stay where we are with July 1st.
Sorry, Senator, I'm not
Still
seeing
muted.
July 1st.
Yes, Senator Carney, go ahead.
No, I think it makes sense to start. So I think it makes sense to start with January 1, 2022, because that's when we can leverage those federal funds.
Okay.
That's the first opportunity.
Then I will defer to and I will amend my motion to have it start, that this ought to pass as amended with the start date of January 1st, 2022.
Yes, Representative Jevner.
Thank you, Senator Claxton. I am still just concerned about the future, after the 7 years, and if we are having to, again, apply for a waiver, if we are, setting in statute that we're going to extend this to 12 months, and after that period, having to apply for a waiver for 12 months. If you look at the chart, on the other states that have been asking for those waivers, there are not any of them that have been actually approved don't go to the 200% of the federal poverty level. And that's up to 12 months. None of them that have been approved have been 12 months and above that 200%. So as we, look forward to that future, we do have to keep that in mind as we move forward with this. If we say 6 months in this statute, I think I have a question of how that's really going to work. If we put in statute, 12 months and then finding out after these 7 years that we have to come back. If we put this in statute just as the 6 months, what does that really do for us looking forward in the future?
Okay, so I have a question for Aaron. Could we structure this? We would extend the benefit using federal available dollars for 7 years and then apply for a waiver after that, assuming that this goes, the current Senate bill gets passed.
I think I'd have to double check with Luke, but when they do fiscal notes, it goes out the next 2 fiscal years, and those costs go into the biennium or the baseline. And so you don't amend things in the baseline like 5 or 7 years out.
Okay.
And the other thing that I'm struggling with is that the unallocated language here directing the waivers are typically of a short-term duration, so it would be difficult to have them effective 5 or 7 years out from now. It's typically a shorter time frame.
Could write the legend such that it's consistent with any legislation passed by the federal government.
In what way?
As far as the 12 months and as long as that's in place at the federal government level.
Yes, you can, but there is, I believe, a constitutional issue about delegating authority to the federal government. And so your state law would then be 100% dependent on some change of Congress.
Yeah, Representative Perry, do you have a question?
Yeah, I think my question was, and you had mentioned it, Senator Claxton, was with available federal funds. leave the waiver requirement out of it, leave the available federal funds in it, that will put us into the 12-month, which I think we very much need. And the decision will be made if the federal government decides to change this in 7 months, 7 years. That could then come back as a requirement to do something legislatively in terms of moving that forward. Because I've seen bills like this come forward with a deadline that got extended in the federal government once those benefits have gone forward. So I think that would at least give us time to look at how this works and then move forward. I'm assuming we can do that. I'm not sure.
Representative Javner, did you have a question?
Thank you, Senator Claxton. I just really want to make a comment. And, this is not the policy piece here of understanding that, yes, it is very important for women to have 12 months of postpartum care. I understand that completely. It's a simple fact of, being fiscally responsible and understanding that, once we add this to the baseline, like Aaron has mentioned, where it's, to change that out of that baseline. So if we have it at just the 6 month, the 6-month level, that is a huge difference between the 60 days. And so I'm very uncomfortable with putting, voting this forward. I was very pleased with our compromise that we were able to work on last session, to have a unanimous vote, but I'm not going to be able to, move forward with that funding piece in question, even looking out forward, even if it comes from the federal government, I have a responsibility, for my constituents. So it's a funding piece. It's not an issue of the policy of women needing that that care.
Can I ask a clarifying question of you, Representative Javner? What number are you using for the 6-month figure?
I was looking at the amendment that we had proposed last session and seeing that note. I'm sure it will be different if we were to move forward for this year.
What was it? Do you remember? Can you recall what that fiscal note was for the 6-month provision? I vaguely remember something under like 225 or something like that. Oh, do you have an answer to that, Senator Carney? Great. You can unmute yourself and share your knowledge.
I was hoping to, but I pulled out the wrong piece of paper. Give me another minute and I'll see if I can find it from last year. But we do have a fiscal note for this year.
Right, which is $400 a year, basically.
Yeah. Let me look a little bit further.
Okay, I just was curious what Representative Javner was comparing. Yes, Representative Craven.
Thank you, Mr. Chair. I would like to know how many families actually qualify for this kind of benefit. We have 13,000 babies that are born in Maine in its entirety, and that includes, private pay as well as folks with who has traditional Maine care. It can't be very many people, and it would be so critical, to have this.
I think the number we got in testimony was 700 a year. So, yes.
Yes, that's correct.
Yeah. Did you come up with that number for 6 months, either Senator Carney or Representative Javner?
I can share my screen if you'd like.
Do you have it, Aaron?
Yes.
6 months? Okay.
I can't explain it, but I can share it.
Right.
So this was this is the fiscal note on the committee amendment that provided the 6 months. And I can't explain. I don't know why there's no fiscal cost, and I can't extrapolate that to how it would affect this number here.
Okay. All right.
Because I'm sorry, I'm not a numbers person.
No, that helps. Senator Carney, is your hand up again? Yes.
Yeah, I wanted to address the 7-year question, because I appreciate where everybody's concerned about that. The Congress looks at these programs and changes benefits and reauthorizes them periodically over time. So I don't know if you all remember, about 2 years ago, there was the big CHIP reauthorization bill that passed federally. And I think that happens like either every 7, 8, or 9 years. I'm not remembering right now. And so I think that's the 7-year, while the 7-year suggestion in the Federal Rescue Act could, it could mean that they intend to cut it off after 7 years. It also could be that that's just part of their cycle in the federal government of reviewing Medicaid and CHIP programs, because they do periodically do a major review of the program and update benefits. And so I wouldn't necessarily look at the 7 years as a cutoff period so much as perhaps a review period.
Would people concerned about the fiscal impact feel better if we were to table this and wait to see where the dust settles in DC and give us a better sense of what was there? I mean, the argument for doing something now is that you're going to address 700 kids for 7 years. That's still 4,900 kids. That's a fairly impactful piece of legislation. But I agree that last year getting to unanimous was a significant victory, and I'd like to leave open that option. Does that make any difference, Representative Javner, in your thinking about extending it to our work session to another time, tabling it for now?
That's fine. Yes.
Okay. So, yes, Aaron, did you have a question?
I just wanted to say that unless you were actually going to put in a repeal date on this statutory change, this requirement would persist in state law until changed by the state. And so regardless of whether the feds extend it past I think it might be 5 years in the Senate bill, or the 7 years in the House bill, or whatever number of years it is, this law persists in state law until changed by this legislature.
So we could put a sunset in for 7 years, be consistent with the feds, and then create the opportunity for people to pick up the baton in 7 years. That's a question. Wouldn't you agree?
To me,
yeah, to you.
That's a policy decision on your part. Technically, we can draft sunset provisions on whatever you wanted. If you decide to do that, you might want something to trigger the legislature's knowledge that this section is going to be repealed with a report or something. Otherwise, it'll just disappear on you.
Okay. Senator Baldacci?
I'm comfortable going forward with a vote, Mr. Chairman, because if the legislation passes, I think we discussed this in other contexts, we can amend, we can come back and amend, but I don't, unless it was going to lead to a unanimous vote, I'm comfortable going forward today. I don't know if just because the federal government's going to basically finance it, whether that's going to convince everybody to support this. But I'm happy to do whatever the chair wants, but I'm not sure what we're going to get out of tabling.
Senator Moore?
I just really want to make a comment in looking at the fiscal notes. If our preliminary fiscal note on this current bill is only showing it to be about 400,000, I'm wondering why our fiscal note the last session for 6 months rather than the 12 months was more than what's being shown in this. So I question the fiscal note on this bill. I'm not sure.
So I'm going to take a stab at that in the absence of anybody who really knows the answer. And my guess is that a number of folks are now covered under the expansion of main care who are already getting coverage. So the number 700 would have been closer to 1,000 before, is my guess. Yes, Aaron. Okay.
Sorry, I just didn't.
You just bailed on me. Did that, that doesn't firmly answer your question, Senator Moore. In my mind, that's an argument for maybe reconsidering how that was obtained a year ago and being
I
clear
just got a
about that.
text. Sorry, Senator. I just got a text from Luke that says he can explain this if you'd like him to.
I would love to have Luke explain the difference.
So hopefully he'll join us in a minute.
I am poised and ready to let him in. But Carrie can do that too. So in partial answer to your question, Senator Baldacci, if we can get to a unanimous, it always looks better on the appropriations table. And it's, it feels like we did our duty, working hard at trying to find some common ground. So.
Oh, I totally agree, Mr. Chairman. I just don't know if that is going to actually cause anybody to change their vote. So.
Well, in a pre-COVID world, we would excuse ourselves for about 10 minutes, and the chairs and leads might have a chance to chat informally, and we could provide some more direction. We can do that this year. We can set up I can set up a Zoom if people would like to do that. So, and this year's answer really has to be into table more often than we typically might. Yes, Representative Madigan.
I just want to speak up while we're having this little interim thing going on here. I want to register my vote for LD 93.
Oh, okay. So
And I
that
want-
Mm-hmm.
would be Anna if she's still here.
Oh.
Carrie keeps the votes officially on these.
On these, I'm sorry. Yeah, I'm still budget
I want
oriented.
to vote ought to pass as amended.
Thank you, Representative Madigan. I have you down as yes.
Thank you.
Okay.
There's a number of other votes, Representative Madigan. I think that's you could record yourself on.
Luke, did you want to try and explain the disparities between the 577 and change and the 400 and change?
Yes, I would love to do that. So again, it's Luke Lazar, Office of Fiscal Program Review. And Senator Claxton, you were right on the button with your explanation. Just to give you the actual numbers, when the bill was done last year, LD 1957, it assumed 900 members a year would essentially access this service. When we redid the numbers for this year, it came up with 250 members utilizing that service. And that is actually straight out of the claim system. So that's actually using the number of members who were using this service postpartum who did not transition to a different category. And that different category is essentially Medicaid expansion. So Medicaid expansion has dropped quite a bit, the number of individuals who would access this postpartum care.
Very good. Thank you, Luke, for explaining that.
You're welcome.
Okay, so I was off by 100 people. So, yes, Senator Moore.
So I just want to clarify that then. So instead of the 700 that we've been talking about, it's technically only 250 people that would be affected by this bill. Am I understanding
That's
that?
what the estimate is based on, yes, 250.
All right, thank you.
250?
Instead of 700. Yeah.
Okay. Does that answer your question, Senator Moore? Okay. Yes, Representative Jabner.
Thank you very much, Senator Claxton. Can I request permission to take a break for 5 to 10 minutes so that our guys can caucus?
Absolutely. So we'll be back at 3 o'clock, hopefully, and turn on your video when you're ready to resume, and we'll take a break until then.
Thank you very much.
Oh, sure. So I will resume this committee work session after a break for caucus. Senator Moore.
Yes, thank you, Senator Claxton. I would make a motion that we table LD 265 to allow for further conversations, deliberations, and to hear what the final results are from Congress.
Second it.
There's been a motion made and seconded to table this. So before we go to Carrie, we'll pause, and now it's your turn, Carrie. The motion on the floor is to table LD 265.
Representative Zager,
No.
Representative Zager, no. Representative Lumlin,
Yes.
Representative Lumlin, yes. Representative Stover, Representative Stover, are you there?
I don't see her. Oh, she's there.
I'll circle back.
Yeah.
Senator Baldacci. You're
We didn't
muted,
hear you,
Senator.
Senator.
Sorry, no.
Senator Baldacci, no. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
No.
Representative Craven, no. Representative Madigan,
No.
Representative Madigan, no. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
No.
Representative Meyer, no. Senator Claxton,
We want to check and see if Representative Stover's back.
Representative Stover,
She'll be
This
back in a
might- I'm
few,
s-
she'll be back in a few minutes, but
Okay.
go ahead and conclude the vote.
So the answer to your question, Ms. Withy, is no.
Senator Claxton, no. That's 6 yes. 6 no.
So the motion doesn't carry. And we're back where we were. So any other questions we want to ask before we entertain a motion to approve or not approve? I don't see any. I'll entertain a motion. Senator Baldacci?
Let's see, Mr. Chairman, I would move to ought to pass with the start date of 1/1/2022 and a sunset provision of 7 years with the department to provide some sort of periodic report to this committee as to how this program is working.
Second.
There's a second to that motion. Any further conversations? Would it be considered a friendly amendment to remove the waiver position? Go ahead, Aaron.
I didn't mean it. I wasn't going to interrupt you, Senator, if you
Okay.
want to finish your thought.
Yeah, would it be a helpful amendment to remove the waiver application provision as being unnecessary based on what we understand?
Yes, Your Honor. I feel like I'm in court. Yes, Mr. Chairman. I was going to make you a judge and you're going to make
Oh,
me a.
no.
There we go.
No,
Yes,
no.
Mr. Chairman.
Okay. All right. So so it'd be amended on those 4 items. So Aaron, did you have something to contribute?
I guess I just wanted to check in about the 7 years because I think that the version of that the Senate passed, the information I got during the work session is that it's 5 years. And certainly the law isn't final yet. So if that stimulus bill, for whatever reason, I don't know what's going to happen in Congress, weren't enacted and you don't have waiver provisions, you wouldn't have the timeline that would be specifically directed in the bill as drafted. Just putting that out there. It's your amendment, but I did want to clarify whether the 7 years was tied to what you thought the federal government was or wasn't doing or not.
Right. So I guess that there should be annual reports to this committee regarding the progress of the program. And I do think there should be a sunset. And Mr. Chairman, I defer to your 5 years is fine as a sunset provision. I think that will give the state plenty of flexibility, making sure that we get every dollar that we can covered by the federal government. And we're not starting it till 1/1/2022.
Yeah, that's the way the current proposal is. Any other thoughts about that? 5 versus 7 looks like the piece that isn't very clear at this point. And we can't write the legislation such that's consistent with law, federal law. That's not an option because that's the separation of powers issue.
But we can.
I mean, you could do it. I'm just pointing it out that it's a constitutional issue. The legislature can enact unconstitutional legislation if it so chooses.
Yeah. Okay. Okay, and we could do it with 7 years. If it turns out it was 5, then we could add in the waiver provision when the federal program expires.
I'd feel better just doing the 5 years, Mr. Chairman, if that's okay.
Okay. Senator Carney, how do you feel about 5 years?
Honestly, I think that I would include whatever the committee is comfortable with, and then by the time you do language review on the bill, we'll know exactly.
Okay.
I thought that the version that had passed the House, I thought the 5 years was a couple versions ago, and that the last several versions in the House and Senate had been 7 years, but I could be mistaken.
Rita forwarded me information from somebody at Georgetown that said they went back to the 5 year, so that it started at 5, the House engrossed it, the version was at 7, and I think the Senate version went back to the 5, but I haven't been able to look into that myself during this work session, but that's the information I have.
What else are you doing?
5 is the right number then.
Okay, so we have on the floor an amendment to approve LD 265 as amended. The amendments to be start date of 1/1/22, a 5-year sunset, an annual report to the committee HHS. Did I miss anything? We're going to remove the waiver option, the waiver language. Those 4 things. Yes, Senator Carney.
I just wanted to confirm that we're comfortable. I don't personally, because I'm not that familiar with the waiver language and when it's required or not required. I'm assuming that it will not be required under the Federal Relief Act. But if we were, I guess I'm all set. Thank you.
But if we, just for a point of clarification, and Aaron and Holly and Molly might need to correct me here. If we put this in place and there is a waiver provision, that doesn't prohibit the department from applying for a waiver, if that's what you need to do to be compliant with this.
That is, I believe, correct. But there are a number of other provisions that you remove by taking out the waiver, such as the source of funding, the implementation of the rulemaking and status. Well, you have the annual report back, but you don't have the quarterly. You would remove the quarterly one about the waiver process as well.
Okay. Any other thoughts? Anything you want to contribute, Molly?
Yeah, I would just want to check with main care about what they need to implement this as far as authority. There are certain waivers for which we need explicit authority to apply. And even when a service is state funded, often we need CMS approval. And so I just want to offer that caveat and know that we'll have the opportunity during language review to provide our input, but want to put that on folks' radar.
Okay. All right. Are there any other questions? Anything else anybody wants to raise? So the motion on the floor is to pass as amended, LD 256. So Carrie, why don't you run the vote?
Representative Zager.
Yes.
Representative Zager, yes. Representative Lumlin.
No.
Representative Lumlin, no. Representative Stover. Representative Stover is absent. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 5 no, 1 absent.
Thank you. Thank you. All right. So that gets us to LD 372. The CHIP expansion.
All right, hold on. I gotta switch gears. Okay, can I share my screen with the bill analysis?
Sure.
So this bill is an act to provide Maine children access to affordable health care, and it makes the following changes to the Cub Care program. I've tried to note which sections these provisions occur in, although section 3 covers several
Can you
pages, but
shrink that column to the right? So we
oh
can-
yeah, I'm sorry. Thank you. Is that better?
Yes.
So this bill proposes to change the maximum eligibility level for family income from 200% of the federal poverty level to 300%. It provides that if the Cub Care program expenditures are anticipated to exceed the budget, the commissioner may lower the eligibility of federal poverty level. It removes the 3-month waiting period for enrollment following the loss of health insurance under an employer-based plan. It establishes that eligibility is not subject to an asset test. It provides coverage to persons who are 19 and 20 years of age and to non-citizens under 21 years of age, and provides that the state would have to implement those provisions using state funds. And it repeals, I mean, it says they can apply for the waiver, but it's likely that they will use state funds for those initiatives. It repeals the provisions regarding premium payments for the Cub Care program. It directs the department to seek federal grant funds for outreach activities and increases the budget of those outreach activities from 2% to 3%. And it requires the department to submit a waiver or state plan amendment to federal CMS to implement the act. And it makes, there are a couple of provisions that are particularly involving the waiting period, the 3-month waiting period, and the premium payments. Implementation of those provisions of the act would be contingent on approval of a waiver of those requirements by CMS. At the public hearing, you received a proposed amendment from Kate Endy with Consumers for Affordable Healthcare. The language she's proposing is below, but the substance is to amend the bill so that all non-citizen children who are not otherwise eligible for Medicaid can qualify for CHIP if their family income meets the federal poverty eligibility level. The committee didn't have any additional questions for the work session. I'm including here, though, links to the federal regulations that are cited by the department in its testimony. I probably should have noted that this third bullet point here points out that an asset or resource test, as the department notes, is already prohibited by the federal regulations.
Okay.
And we haven't received a preliminary fiscal impact statement yet.
Can you go back to the first page, Aaron?
Yes.
And maybe Senator Carney can explain to me why there's paragraph number 2.
I think I can, and that is because we're working within the existing Cub Care statute, and that language is already in the Cub Care statute, and the change that this bill makes is simply to take out 200% and insert 300%. I found that confusing in the original statute as well, and I'm not sure why it's in the original statute, but because I didn't understand it, I didn't feel comfortable removing it. When my intent was just to change the level of eligibility.
Okay.
But it's confusing. I agree with you.
Is that something you can address, Aaron?
I don't think I have any additional insight. That paragraph in general seems to give the commissioner the ability to adjust eligibility based on however amount of funds have been appropriated. So if an adjustment needs to be made to stay within that amount, but beyond that, that's all I can get from the language.
But my sense is that in the first part, you increase it to 300%. And the second part, you say it can't go lower than 300%. So I'm not sure what we accomplished. If you include it to 300%, there isn't any out there for overage.
Didn't draft this one. I don't know.
Okay, I'm just trying to get some clarity. Yes, Senator Baldacci, that's a good out, Aaron.
Mr. Chairman, how long is it going to take to get a fiscal impacts statement on this? And so we have a understanding about the budgetary issue. Do we have any idea, or are we it's gonna be a month or 2? It's gonna be further than our timeline is.
You have to vote out at a committee amendment in order to receive a fiscal notice.
Oh, okay.
Sometimes we can get preliminary fiscal impact statements ahead of time, and we get a lot more than other committees because Luke really spoils us. But if that's not available, you have to wait until amendment review.
Okay. I was going to make a motion, Mr. Chairman, to
please go ahead.
Ought to pass.
Is there a second?
Second, and I have a question.
Yes, Representative Craven.
What's the federal match for CHIP? I forget.
Does anybody know the answer to the federal match to CHIP question, Senator Carney?
I didn't know if that was a question for myself or for Molly or for Aaron, but it's my understanding that it is somewhere around 70, it's in the 70s. It also has changed. It was increased by 6% in one of the COVID relief
Yeah, the FMAP.
legislation.
Okay.
Um,
Does that answer your question, Representative Craven? Representative Lemlin.
Thank you, Senator. Do I understand this correctly? If I'm a single dad living in Chelsea, Maine, and I make $65,000 a year, I'm going to qualify for this program? Because it says 300% above the federal poverty limit, 300% above federal poverty for a family of three is $65,880. Now, if I make $65,000 a year living in Chelsea, Maine, I'm a pretty wealthy guy here. 300% above poverty, geez, that's, I would have to say 85% of everyone living in Maine falls under that guideline. So why would we approve this? And number two, I cannot go to, I don't know of any country in the world. I know I can't go to Canada. I know I cannot go to Mexico. I don't know of any country I can go to as a non-citizen and collect their welfare system. I don't know of any place. So why are we doing this if nobody else in the world would do it?
Is that a question directed at?
No, not yet. Luke, I saw you had your hand up. Did you want to contribute here somewhere?
I just wanted to give you the current FMAP. That's what I was chiming in for.
Oh, okay.
It's always right around 74%, and the current FMAP for the current federal fiscal year is 74.58%.
Mr. Chairman, my motion was to pass it. I didn't say as amended.
No, I know.
Okay, so the non-citizen thing is not part of what I had asked to pass.
I understand, but it's in response to.
Yeah, no, I just wanted to be clear for the record.
Yeah, no, I understand that. Yes, Representative Zager.
Thank you, Mr. Chair. I think that it's important to remember that CHIP is one of the most far-reaching, most impressive, beneficial programs for children's health during the lifetimes of anyone here. The committee may recall that it was sponsored by Senator Orrin Hatch, co-sponsored by Senator Orrin Hatch, one of the most leading Republican senators. He served more years than any U.S. senator in history, and he only a year or two ago retired. He passed this, and he was chair of the U.S. Senate Health Committee. He lobbied for this, and one might ask, why would a conservative leader support CHIP, especially fiscally? People who are fiscally conservative. Perhaps it's because CHIP works. Outcomes and cost measures both show that it works. It improves outcomes and lowers costs. Even in Senator Hatch's own state of Utah, in his own state of Utah, researchers looked at whether, what are the outcomes, and found that it saves the state's money because it shifts costs away from more frequent emergency care situations. And so it found that cutting or denying people this kind of coverage just made it so that that there were other costs elsewhere in the state, that it was sort of false savings to not fund CHIP. I recognize the concern that has been raised about citizenship or non-citizenship. I actually have lived in other countries that do cover non-citizens, but I think that fundamentally it's important to remember that this this program is not especially partisan. It is bipartisan in its origins. It works and it lowers costs. Thank you, Mr. Chair.
Thank you. Representative Javner.
Thank you, Senator Claxton. I don't think it is an issue of whether or not the program works. At this point is an issue of raising it to 300% of the federal poverty level. So at this point, I mean, we're willing to take a vote, but we will be offering a minority report. So.
Very good. Thank you. Representative Lemelin, did you have a follow-up question or concern?
Yes, I did, Senator. Thank you. Yeah, I just wanted to state that I don't believe there's anybody on this committee that is more in favor of the CHIP program than I am. I'm 100% on board. The problem is the 300%, and the other problem is the non-citizens. Thank you.
Understood. Thank you. Yes, Representative Perry. Oh, you need to unmute. Sorry.
Yeah, I think you'd probably rather have me muted, but anyway, the motion that was brought on board does not have the non-citizen in it. Am I correct?
That's correct. There isn't any adjustments to non-citizens, but the bill as drafted does provide CHIP coverage to non-citizens under 21 years of age who are not eligible for, who do not meet the federal poverty level eligibility under main care.
I thought that was the amendment.
Nope, that would, there are other reasons I think why someone might not be eligible for main care. That amendment proposed to scoop all of them in. This had to do with the federal poverty level, and that's under, I can tell you where in the bill it is. It's on page 3 of the bill at lines 30 through 36.
Okay. Mr. Chairman, I would just ask, I would want to amend my motion to include non-citizens, comma, who are otherwise legally present in the United States. I want it to be clear that we are not condoning or supporting anything that is not in compliance with the laws, but if somebody is here legally present, then I think that they should have equal protection of the laws, but I wanted to be clear that we're not supporting something beyond the law.
So who seconded Senator Baldacci's motion?
I did.
Are you comfortable with that, with what he's restated?
Yes, I am. I just wanted to point out as well that CHIP only covers children, and England and France both cover non-citizens. Thanks.
Senator Carney.
Thank you very much. I want to address actually Representative Lemelin's issues briefly. I don't think that he was present when I introduced the bill, but why the 300% is that wages are increasing at a much lower rate than the increasing cost of employer-sponsored health coverage. And the result is that many working families are unable to afford employer-sponsored coverage, and they also can't afford coverage on the exchange. Kate Endy from Consumers for Affordable Healthcare is, I believe, an attendee and could provide some more in-depth analysis on that. But it's really about the way healthcare premiums and co-pays and deductibles are just skyrocketing out of the reach of working families. On the CHIP for children who are not, I like to think of it as covering all children actually, but currently it is my understanding that CHIP will cover children who are lawfully present in the United States, who are non-citizen, whose families are pursuing a process to a legal authorization to stay in the United States. And that is a lot of kids, and that's great coverage. There is a very small number of children in Maine, and The best numbers I've been able to get are somewhere between a dozen and 50 who are here without any and are not pursuing any lawful process to stay here. Those kids, if they have some kind of life-threatening health condition like a severe asthma attack, they can get rushed to the emergency room, and Medicaid will provide coverage for that emergency room treatment to rescue that kid and to keep that child from dying from the severe asthma attack. But that child under our current system can't see a pediatrician and get prescribed an inhaler and receive kind of regular health care for that condition of asthma. And so basically, when we limit the coverage available to this tiny group of kids here in Maine to folks who to only getting treatment for life-threatening injuries in the emergency room, in effect, we're denying them of the kind of health care that will keep them healthy. Regular pediatrician checkups, immunizations, treatment for chronic diseases like asthma. I mean, if they have CHIP, they can see a dentist, they could get glasses. If they have some other severe health condition, they could get treatment for that. And I think that we all, as a state, we all benefit from those children growing up healthy and having their immediate medical needs cared for in the same way that other children do. I think it makes financial sense. And then again, Representative Lemelin, I think that you had raised this too, like, why would we do this? But there are so many studies of Medicaid and CHIP that show that kids who get that health care, they have higher reading levels, they graduate at a greater rate from 8th grade, from high school, from college. When they're adults, you can trace back their income tax payments and see that people who got this health care end up paying more income tax as adults, which is an indicia of their economic and life success. And so I think that it's a hard conversation to have covering this small group of kids, but I hope that you can kind of open your minds and hearts to see how it does make all the difference in the lives of these children to have coverage that extends beyond the sort of emergency room coverage that Medicaid currently provides. Thank you for hearing me out on that.
Representative Lemelin?
Yes, thank you, Senator. I agree with you. This program absolutely helps the poor in absolutely every way that you indicated. That's why I'm in 100% agreement with the CHIP program. My problem again is this. At the 300% level, this is Maine. I can't wait to see the note on this, because when the note truly comes out, and remember, when they do the note, they can't just take the average person on Maine Care. What they have to do is take every single family that is at 300% or less of the poverty level. That is going to be a vast number, and they're all going to jump on board. I mean, I don't know a family around that's not going to jump on board on this. I would have to say that 90% of the people living in my district qualify for this new CHIP program that you're putting through. 90%. And I guarantee you most people here do. So that's where my issue is. It's not with the CHIP program. I agree with you, Senator, 100% that the program works and the results are phenomenal. I'm with you, 100%. It's the 300% that's outrageous. If that were lowered and you take out the non-citizens, I'm on board.
So there's a motion on the floor, and I don't want to get into a lot more back and forth. I think people have had a chance to have their say. Is your hand still up, Representative Lemelin?
My apologies, Senator. I'm just a little lazy this late in the afternoon.
No problem. It's not the first time today. So I just I want to make sure that we're bringing up new argument, new conversation and not repeating old. Senator Baldacci.
Just briefly, Mr. Chairman, this will only apply to children, as it said. That family of 3 or 4, the parents will still have to get their own insurance. But what it allows, okay, in the broad scheme of things, Maine has one of the most successful reinsurance systems actually in the country in terms of helping to stabilize premiums. This, whenever we are able to insure like a family of 4, if 2 of them can be insured through Cub Care, then the parents can have access to more affordable private health insurance care. I mean, it's going to help the whole system by insuring more people. That's all I wanted to say, is that will only apply to the kids.
Okay, thank you. Representative Zager.
Thank you, Mr. Chair. Just to add one more thought to advance the conversation. I guess my question that I'd like people to keep in mind is if something's working, why won't we do more of that? It's kind of like in the military in artillery. When you hit your target, you fire for effect. You mass force on something that works. Thank you, Mr. Chair.
Thank you. All right. So we have a motion on the floor that's been seconded to approve LD 372. Any other comments? I appreciate everybody's contributing. So we can go ahead and move this forward, Carrie, by doing the vote.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover. Representative Stover is absent. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 5 no, 1 absent.
Is there a minority report?
Yes. Mr. Chair, may I?
Please.
Thank you. Aaron, we would like the minority report to read. It's the same as the minority report from last year on the LD 1539 that was brought forward. Do I need to read out all those pieces, or do you have any
You're
other
not
questions?
changing anything from that report, then that's sufficient for me. Thank you.
Thank you.
Okay. So
Thank you all for your consideration today. It was nice to spend the afternoon with you.
good luck with your committee. I hope that's still working. So I think that concludes the work session portion of our afternoon. Is there any other business to be brought forward? And I look to our analyst.
Not that I know of.
Okay.
Unless you want to do reports.
So I see some head shaking again. Representative Zager.
Mr. Chair, I'm not actually volunteering for a report. But I just wanted to say I'm looking forward to seeing folks in person tomorrow.
Amen. Okay. Any other comments before I entertain a motion to adjourn? Thank you, Carrie, for all the vote taking. I'll entertain a motion to adjourn. Yes, Representative Lemlin. There's a motion And a second, Representative Connor, did I hear that? Okay. All those in favor of adjourning until tomorrow or till Monday next? Thank you all. And chairs and leads will meet shortly.